Good afternoon. For the record, my name is Erin Murphy, at-large City Councilor, and I am the Chair of the Boston City Council Committee on Strong Women, Families, and Communities. Today is April 24th, 2025, and I guess they want the exact time, is 2:08 p.m. This hearing is being recorded. It is also being live streamed at boston.gov/city-council-tv and broadcast on Xfinity Channel 8, RCN Channel 82, and FiOS Channel 964. Written comments may be sent to the committee email at ccc.cpa@boston.gov and will be made part of the record and available to all councilors. Public testimony will be taken at the end of this hearing, and individuals will be called on in the order in which they arrived, and they can sign up at the entrance of the chamber, and you will have 2 minutes to testify. If you are interested in testifying virtually, please email Central Staff Liaison Cora Montrond at cora.montrond@boston.gov for the link, and your name will be added to the list. Today's hearing is on docket 0183, in order for a hearing regarding the City of Boston response to sexual assault, domestic violence, and related resources for survivors. This matter was sponsored by Councilor Louis-Jean, Gabriella Coletta Zapata, and Councilor Durkin, and was referred to the committee on January 8th. Today, I am joined by my colleagues in order of arrival, Councilor Louis-Jean, Councilor Braden, and Councilor Flynn. We will start off with opening remarks from my colleagues, and then I will introduce the first panel. Thank you all for being here. So I will start with an order of arrival also. Councilor Louis-Jean, you can start.
Good morning, everyone. Thank you so much for being here. I'm Council President Ruth Louis-Jean, an at-large City Councilor, and this is going to be an important conversation, and I just want to thank everyone for their work. I'm nervous having this conversation because it's such a difficult issue, and I know that it's going to be triggering for folks who have their own experiences of domestic violence, of intimate partner violence, of sexual assault. And I know it's really important that we have forums to have these discussions so that we can do the work of addressing the root causes of intimate partner violence, to see what we're doing well, where we can allocate resources better to help victims, and how we really make sure that we are building on community-oriented solutions. I want to root today's conversation in safety and compassion. So if anyone needs a break, if anyone needs an extra moment, please don't hesitate to take it. We can always, with the chair's permission, we can always take a short break if anybody needs, so that folks and everyone can recenter themselves. My hope is that by bringing us together with survivors, service providers, public health professionals, law enforcement, and community advocates, we can deepen our understanding and strengthen the collaborative safety net that so many of us rely on during the most vulnerable moments. This hearing is more than just an opportunity to examine our current programs. It's a chance to listen, to reflect, and reimagine a system that truly serves survivors. Not just about crisis response, which so many people are involved with, and I want to thank the people here from the Boston Police Department. We also have to ask ourselves how we're truly supporting healing, addressing root causes, and dismantling barriers, cultural, linguistic, legal, and institutional, that prevent survivors from being seen, heard, and helped. Systems don't operate in a vacuum, and if we're not intentional, they can reproduce the same harms we seek to end. That's why centering survivor voices in everything we do, and I know that there are survivors here, and I want to thank you so much for your advocacy. That their voice is important in designing services, allocating resources, shaping our laws, and holding institutions accountable. Survivors are not a statistic or a policy point. They are our neighbors, family members, friends, and community leaders, and their experiences must guide our path forward. As a young girl growing up here in this city, I myself was a victim. We're in April of Sexual Assault Month, and so many of our young women and men are victims of sexual assault. At a very young age, when I was in college, I knew nothing of how to really deal with intimate partner violence, and found myself in a family situation where I was really having to intervene. in a difficult situation. And then as a lawyer, it really became very clear to me in a lot of my housing cases that where there was an element of domestic abuse, of the many reasons why people in intimate who experience intimate partner violence, why they feel like and why they often have no choice but to stay in those situations. So I again appreciate you all for all the work that you do and hope to leave this hearing with some calls to action for us as legislators to really work better in partnership, doing the work of education and supporting those who are experiencing these harms. Thank you.
Thank you. Councillor Braden.
Thank you, Madam Chair, and thank you to the lead sponsor, Council President Louis Jean, for calling for this hearing, and the other two councillors who are not able to be here today. And thank you all for being here, and thank you to the survivors who are here to give testimony as well. I think this is a hugely important issue, and I think it feels like a bit like an iceberg. We just see the tip of the iceberg, and there's so much more that we don't see, given the sort of stigma and the notion that people have to guard themselves and not really tell their story, so that we all know what's going on. I do look forward to the conversation this afternoon, and I hope that we can identify some places where we can improve the situation. I know from just dealing with constituent calls in our district that, and I did find out from BPHA recently that, you know, Alston Brighton District 14, that particular area has a higher than average incidence of domestic violence in the city of Boston, which was very new to me. I didn't know that. And the other issue that we hear about is folks who are having difficulty in their housing situation because they've got a new apartment, but the abuser finds out where they are and comes by and causes trouble, and then the neighbours are upset, and you find themselves in this constant cycle of being displaced over and over again, which is just repeating the trauma. So I think it's a very complicated issue, and I really hope that we have a really good conversation this afternoon. Thank you all for being here.
Thank you. Councillor Flynn.
Thank you, Madam Chair, and thank you for the important work you have done, Madam Chair, on this issue. I also want to acknowledge the panel for being here, the work you have done, but also I'm looking forward to hearing from survivors and community partners as well, to acknowledge the work they are doing supporting survivors. I have been deeply involved with issues relating to domestic violence and sexual assault since serving on the council 7 years ago. I held hearings in 2018, 2019, 2021 with then City Council President and now Attorney General Andrea Campbell. I worked also closely with Council Flaherty on this issue. But I do want to acknowledge former Council President Campbell. We had a domestic violence hearing at Northeastern University Law School, and both of us sponsored it. She did most of the organizing, and it was by far the best hearing I've been to in the City Council in almost 8 years. And she really brought together the community and listened and came up with some plans and policies that I know are helpful now across the Commonwealth. But she really led on this issue on the City Council. Just want to acknowledge her. I have also worked closely with a number of organizations, including the Asian Task Force Against Domestic Violence, CASA Myrna, to continue the work of my mother, who did a lot of work on this issue. She supported survivors of domestic violence when she was the First Lady of Boston. According to the 2024 year-end crime stats report released by the Boston Police, there were notable increases in Part 1 crime, especially categories of domestic and non-domestic assault, up by 43 and 23 incidents, respectively. During the start of this year, I also tried to establish a standalone City Council Committee on Domestic Violence and Sexual Assault. This is something that's still a priority for me. Although this is a difficult issue for all of us to talk about, it's important that we do come together to learn more about the issue, but really to listen to survivors and how we can be more helpful. We also know that this impacts every community across Boston in the LGBTQ plus community, in which I represent a large number of residents. In our immigrant communities, which I have a large immigrant community, communities of color as well. I'm looking forward to hearing how we can continue to work together, ensure that we're doing all we can to try to increase awareness, education, supporting survivors, offer resources, reporting how we report those to the Boston Police. And I also want to acknowledge the Boston Police Department. I follow crime stats very closely and do know that there was a recent arrest of a young girl, maybe 14, 15 years old, being trafficked, human trafficking, for prostitution reasons, I guess, through many neighborhoods of Boston. So I want to acknowledge the professional work of the Boston Police and investigators in making arrests. But I also want to say thank you to the Family Justice Center out of the Boston Police Department. They do an exceptional job. I've had the opportunity to visit many times. Looking forward to going back there again sometime this summer to learn more. Thank you, Madam Chair.
Thank you. Thank you all for being here. I know it's already been said by my colleagues, this is an important conversation. I often say what our most important job as a counselor is quality of life issues, and I would put this in a category of like survival of life, right? And for many of the victims, it's life or death situations for them. And I'm glad we're focusing also on the resources, because we are a rich city and we do have a lot of resources, but we often lack for many different reasons, not for the will or the hard work of the city employees, but we do lack often connecting people with the resources. So I think it will be great if we leave here with more of a knowledge for myself, and my role to be able to connect those who need the resources that are already out there. And I'll introduce the panel, but I do just want to say thank you, Kim. I know we met last week in my office. You're new. You have a new role, not new, but you have a new role in the city. So when you introduce yourself and speak, I think it will be great to share with my colleagues, but just, also those who are here in the room, that, the importance that I know the Boston Public Health Commission puts on this issue, and making sure that your role is also, supported by us on the council, and how can we work together with the police and all of the other nonprofits. And I'm also looking forward to the non-administration panel. We have a lot of amazing workers who are out there day in and day out and just really get it and know what the survivors need. So looking forward to hearing from them also. So we will start with, I'll introduce, or you guys actually, you could start here, introduce yourselves, and then I know Boston Public Health will go first. Yep, thank you.
Go ahead and introduce yourself.
Hi, Kim Mendoza-Iraeta, Director of the Domestic Sexual Gender-Based Violence Prevention Initiative at the Boston Public Health Commission. Thank you.
Mark Scott, Interim Director, Office of Violence Prevention, Boston Public Health Commission.
Mark Sullivan. I'm the Sergeant Detective at the Boston Police Human Trafficking Unit.
Jose Texera, Lieutenant Detective at the Boston Police Department, in charge of the Sexual Assault Unit.
Terry Thomas, Captain Detective at the Family Justice Center.
Good afternoon, everyone. Victor Evans, Deputy Superintendent from the Boston Police Department, Bureau of Investigative Services.
Awesome. Thank you all for being here. You can start. Thank you.
Thank you, counselors, for having us. I am, again, Mark Scott. I serve as the Interim Director of the Office of Violence Prevention at the Boston Public Health Commission. The 5 programs in the office work with residents most impacted by and engaged in gun violence, with community-based organizations to prevent and respond to gun violence, and to provide trauma-informed training to agencies and organizations working to prevent violence. The Domestic, Sexual, and Gender-Based Violence Prevention Initiative is the most recent effort of the Office of Violence Prevention. It supports and builds on the work of the Family Justice Center. We are thrilled that Kim has accepted promotion from their excellent work with the Capacity Building and Training Initiative to assume leadership of this initiative. I've had the privilege of watching Kim's community health, training, facilitation, and anti-violence career since their early work at the Whittier Street Health Center. Kim is a proud, lifelong resident of East Boston who has done and will do much to make Boston a safer city for all its residents. So with that, let me turn it over to Kim to say more about what the initiative is about and what she's doing.
And thank you. You did a much better job than I would have introducing Kim. That was nice. Thank you, Ma.
Thank you very much. Good afternoon, Chair Murphy, Council President Lujan, Councilor Braden, Councilor Flynn. My name is Kim Mendoza Iraeta, and I am the Program Director of the Domestic, Sexual, and Gender-Based Violence Prevention Initiative. Thank you for inviting me today. I'll be sharing about our new initiative, its origin, and its evolution through community engagement, and how we will collaboratively work with community-based organizations within the city of Boston as well to improve the lives of Boston residents, particularly those who are most targeted by racism and systemic inequities. While still engaging in feedback from our partners, the draft goal of the initiative is to create an inclusive and equitable environment that fosters a collective response to and prevention of gender-based violence. I know that there was a flyer being handed out right now, or like of the definition of gender-based violence. This is what, yes, that's exactly right. That is the definition that this initiative will be using to talk about the different forms of violence that affect when we're talking about domestic violence, sexual violence, as well as sexual exploitation, child sexual abuse. So all of that is under the umbrella term of gender-based violence. So as I'm talking and I mention gender-based violence, that is what I'm referring to. The initiative will support organizations interacting and intersecting with survivors, particularly those made most vulnerable by systemic inequities, such as Black and Indigenous communities, people of color, LGBTQ folks, people with disabilities, women, girls, youth, immigrants, refugees, and individuals who are incarcerated or recently released. While this initiative was officially established in January of 2025, the roots of it go back much further. It builds upon the vital work of the Family Justice Center, and it expands Boston's approach to preventing and responding to gender-based violence. It was also shaped by resident voices. During the development of the plan to end violence, alongside the Office of Community Safety here at the Mayor's Office, we engaged over 500 residents in Boston, primarily from Mattapan, Roxbury, East Boston, and Dorchester. Through 16 community listening sessions, we had surveys with young people, with adults. We also met directly with community-based organizations dedicated to responding to gender-based violence. We are grateful for all of those who shared their experiences and their vision for a safer Boston. And through this engagement, one common thread kept coming up over and over. How can we prevent violence before it starts? How can we intervene before violence escalates? And how can we respond to residents' needs related to affordable housing, mental health care access, employment, education, transportation, and what we call in public health those social determinant of health needs? Over and over again, we heard that prevention must begin with education, particularly with children and young people. Programs focused on social emotional learning, empathy, boundary setting, consent, awareness of healthy, unhealthy, and abusive relationships were seen as essential starting points. We also heard a call to de-silo the violence prevention field. One powerful conversation that I had with a mother in East Boston captured this. She described the fear of not only hearing gunshots outside her home, but also from the shouting matches between the neighbors inside their homes. The fear of domestic violence spilling out into the community is real. The cycles of domestic violence and community violence are deeply intertwined, but too often our response to these issues are siloed and remain separate. This initiative aims to break down these walls and take a comprehensive approach to responding to gender-based violence. For example, in partnership with programs such as the We Are Better Together, the Warren Daniel Harrison Project, we have laid the groundwork for cross-training community violence responders and domestic violence advocates to ensure that all violence responding professionals are equipped with the tools and the knowledge that they need to recognize and address multiple and interconnected forms of violence. We hope to identify additional financial resources to develop a risk assessment and a safety tool, planning tool, for both community violence and domestic violence, enabling us to provide more targeted and effective interventions. This theme also speaks to another key focus area for our initiative, strengthening data collection and analysis. It is crucial to better understanding the nature and scope of domestic and sexual gender-based violence and translating these data into action. As a public health initiative, the Domestic, Sexual, and Gender-Based Violence Prevention Initiative is uniquely positioned to collaborate across sectors, across agencies, for example, our very own Boston EMS, hospitals, community-based organizations, BPD, city agencies, to build a safe and confidential data infrastructure that will allow for us to understand the better scope of gender-based violence and make action out of that. We are already laying the foundation for data collection and interagency collaboration with BPD. I give thanks to the support of Deputy Director Liz Curtis, SA Analyst Finley Kemp, Sergeant Emily English, and of course to all of the FJC units. This interagency collaboration and data sharing will not stop at BPD. We know that many incidents of domestic and sexual violence go unreported, and we know that and to be able to expand this confidential data sharing to any city, community, or healthcare organization is the goal. This is because we need a clear understanding of the scope of gender-based violence in the city, and by working alongside our data team at BPHC, we will equitably analyze and share findings in a consistent and survivor-centered and accessible manner that allows us to make informed decisions, prioritize resources, and better serve our communities. Looking ahead, I am excited about the positive impact this initiative will have on our city, in collaboration, of course, with the folks in the front lines doing this work. Through this strengthened collaboration, improved data collection, and a more coordinated response, we are confident that we will create a safer and healthier Boston for all, and we're committed to fostering communities where residents can thrive free from violence and fear. I look forward to answering any questions you may have. Thank you.
Thank you. Were you going to add anything, Mark, to that? Or okay, thank you for being here. Do you have opening statements from the police? That'd be great. Yep, thank you.
Good afternoon. Committee Chair Murphy, councilors, and members of the public. I am Deputy Superintendent Victor Evans from the Bureau of Investigative Services at the Boston Police Department, and I oversee the Boston Police Family Justice Division. I appreciate the opportunity to be here today to discuss the important work that our police officers, detectives, and advocates do every day to respond to and investigate and prevent sexual assault, domestic violence, child abuse, human trafficking, and other related offenses. All the crimes that I have just mentioned are heinous crimes that impact far too many individuals and families across our city. At the Boston Police Department, we are unwavering in our commitment to a trauma-informed, survivor-centered approach that prioritizes safety, justice, and healing for those affected. Response to all victims of crime are a priority for all personnel within the Boston Police Department. We recognize the importance of partnerships between law enforcement and culturally specific community-based victim service providers. These partnerships can help ensure culturally informed responses and assist to meet victims' needs. The Boston Police Department's Family Justice Division is central to this work. It encompasses the Sexual Assault Unit, the Domestic Violence Unit, the Human Trafficking Unit, and the Crimes Against Children Unit. These units are staffed by specially trained detectives, victim advocates, and civilian personnel with expertise in working with survivors of interpersonal violence, including those from our city's most vulnerable populations. Several representatives from this division are here with me today to assist in answering your questions. Captain Detective Terry Thomas, Lieutenant Detective Jose Texera, and Sergeant Detective Mark Sullivan. The Boston Police Department partners with the Boston Public Health Commission and many nonprofit service providers. These collaborations support survivors in accessing immediate and long-term support, including legal services, counseling, crisis intervention, advocacy, and safety planning. I look forward to sharing the work that we do in partnership with the Commission and our nonprofit partners, many of which are represented on the external panel and in attendance today. Thank you, and we welcome your questions.
Thank you very much. We'll get right into questions from my colleagues. We'll start with you, Council President.
Thanks, everyone, and thank you again for taking some time during your afternoon to be here to address this important issue. I think it's a question that I want to address to everyone, starting with you, Director Mendoza-Errejeta, but really also for BPD. Director, you mentioned, and when we spoke, you also talked about the importance of data, and I also agree that if we don't know then what's out there, it's going to be hard to respond. Issues of domestic violence are even trickier, and issues of sexual assault are even trickier because of reporting. I know when I was assaulted, I did not report it, and there are lots of people who, for whatever reason, decide not to report. I'm wondering what trends you are seeing in the data. Have you been seeing an increase in the comfortability of people reporting instances of intimate partner violence, of sexual assaults, and especially in the era of the pandemic where we saw a significant increase in intimate partner violence and in sexual assault? What did we learn from that time period, and how is it informing how we're approaching the work today?
That's a great question. Thank you for asking. Well, I'll start with something that when we were thinking about the data infrastructure as a big need for this initiative was because it is very hard for us to have a clear understanding of where we are as a city in regards to the statistics or the prevalence of gender-based violence. I know right now the closest that we have to hard data is the information that we receive from BPD. And we know, of course, that's just the very, very, very tip of the iceberg because that's only the incidents that are most egregious, the most likely that are reported, and many go underreported or unreported. And so when we thought of the data infrastructure, it was because it was very hard to find data, and it continues to be hard to find data. I know just by conversations with community organizations and community members that during COVID there was a high uptick of calls coming into hotlines and shelter beds were, of course, always, it is always such a challenge finding that, but the uptick of folks trying to call to get those resources went up. When we are also thinking about what the status of the resources are, we know that after COVID they have changed, and where we are right now, one of the sort of data points we're trying to gather right now is a gender-based violence landscape survey. This landscape survey, along with the Mayor's Office of Women's Advancement, went out. It is live, and that is for providers to be able to address and indicate where those gaps and where those needs and resources, because resoundingly, when I speak to advocates and to community organizations, there is just not enough for the demand. And I'm sorry to not be able to give sort of hard, concrete percentages. That is where I hope this data infrastructure will be able to support, because we know that it is happening. So when we're thinking about hospitals, community-based organizations, BPD, there are data is being collected, and when we think about the ways it's being shared or analyzed, it's fragmented right now. And so thinking about this data infrastructure being housed at the Boston Public Health Commission will really allow us to have a clearer view of where we are as a city.
And so the data right now is not currently being housed with BPHC. It's sort of scatter-sited.
Yeah.
And so the goal with the work that you're doing is like to be essentially the central hub to collect that information.
Exactly right. Exactly right.
I got one thing to add. One of the things Kim mentioned was the data infrastructure. So I think what we have is, in terms of what's changed and what's shifted, is the Family Justice Center, which has done and does do excellent work with the nonprofit organizations that are there, along with the Boston Police Department units. And that's where we had our Health Commission resources focused. But this issue is bigger than what is sitting in that building. Some of the organizations that were housed at the Family Justice Center were successful. They grew, they're bigger, so now they're no longer physically in the building. They're still associated with it. They're still members of the Family Justice Leadership Council, but they're physically not in the building. There are other important entities in the city that address this issue, the universities and colleges. Kim mentioned the hospitals. There are many community-based organizations that have never been part of the FJC, and the community is generating their new ones that are emerging. There's your fracturedness that what we want to do with the initiative and the data infrastructure that Kim's talking about is be able to bring that all together beyond just the very important work that happens inside the building.
I think that, thank you, Mark. I think that's, what we've been doing for the last 3 months that this initiative has been live is been connecting with community-based orgs, with higher ed, and just starting that conversation of what would it look like for us to be that central hub, for us to be able to pull together. Of course, it started with BPD, because that's where, our relationship is very strong. And so thinking about our ability to do so in a way that's confidential, safe, because of the utmost importance is the safety of survivors. And so we want to make sure that when we're doing this, we're doing it right, and we're not rushing into anything that can put anyone's safety at risk. And so trying to connect those dots and be able to pull together is challenging in various ways. I think one of the ways I can sort of think about is that every organization has a different way of collecting data. Also, maybe some have even different definitions of what they sort of will check off as domestic violence or, sexual violence, right? Depending also on who is administrating, if there's an intake, who is administrating that intake at the hospital level or at the community-based organization level, because we know that often there are, even with us within BPHC, folks who are not dedicated to support domestic violence survivors are still interfacing with that. In the last 3 months that I've been in my position, I've had multiple folks within the city offices and within the commission just like, hey, by the way, there's a survivor here I need support with, and they're not, they're not the folks to be able to support that adequately. And so alongside with the data infrastructure comes training and capacity building for across and allied sectors to be able to be more adequately prepared to be that bridge to resources, because we know that the resources are there, maybe there's not enough, but how do we connect what the resident survivors need to the resources that are there? I hope that answers your question.
Yeah, that's very, very helpful.
Do the police have on that question?
Well, for me, I'm happy to sort of interject in sort of like the questions that I had directly. The director is talking about the work that they're doing to really be a centralized hub for data, but what are you seeing in the trends and calls that you get for domestic violence and sexual assault, like the number of calls that we get in a year? I think people are nervous oftentimes to be public about the intimate partner violence they experience, but in so many ways, police you get it first, because that's when someone's life is at danger. So how many calls are we getting a year from domestic violence calls? Are we seeing an increase in that number of calls?
Well, just coming here, we kind of had a wide scope on what we were going to discuss today, but kind of trying to focus on the resources that we have and the referrals that we make, different things like that. Just as a brief framework of the domestic violence unit, approximately 12,000 cases per year are assigned to our 12 detectives.
12,000?
12,000, yes. And some of those are going to be, verbal disputes, different things like that. But a critical part of our piece is that we have domestic violence advocates. So we currently have 5. Hopefully 7 will be full staffing at some point. But they have a critical role of like supporting survivors, like emotional support, safety planning, resources referrals with regard to shelter, counseling, financial assistance, legal aid. They also support victim survivors in the legal process. They'll provide rides to court. They'll walk them through the criminal process. If restraining orders are required, some of it will be child custody issues. They can share information. But they're the key point, and they meet routinely, and it's evolving with regard to resources that you have. At the FJC, we house, after the pandemic, a bit of an issue with folks that are actually in the building. Some have expanded and needed more room, which is great. Them not being in the building doesn't prohibit us from utilizing them as a resource. So we periodically will have these meetings, and we try to get everybody in the room, and things evolve. Resources that one advocate has, they're assigned to different parts within the city. So there's different demographics and different things like that. So they learn as they go through. We just recently, one of the advocates really spoke highly of Sahili Boston, and that was something that we eventually shared. Yeah, I know they're here today, but that was one piece that eventually we were able to share with everyone else through a training thing that none of the other advocates were aware of because they didn't have that demographic they were trying to reach out to. So that's very important. With regard to the FJC, just the partners in the building, some other service providers that we utilize that, one, for instance, is the Child Advocacy Center of Suffolk County, just a major partner, invaluable to us. They do remarkable work. I'm in constant communication with the executive director, Annie Marklinger. Our units work with the CAC on a daily basis within the building, working with coordinating efforts, discussing cases. And one piece recently, we're trying to create like a training curriculum with regard to DV as well as sexual assault and try to get everybody in the room that some people have some great expertise and knowledge on different things. And so we're in the midst of doing that as well. But some other partners that are phenomenal, some are here today, I'm sure, is Casa Myrna, the Network LARED, the Asian Task Force Against Domestic Violence, Association of Haitian Women in Boston, Sahili Boston, Mass Alliance of Portuguese Speakers, and Dress for Success. These were just some of the few that when I spoke with the advocates, those were some of the folks that they really utilize on a very routine basis. But, other partners within the building, we'd meet on a quarterly basis. And then during that, it's kind of spans across everything. It's all the members of our units that are within the building, and then different folks come in. DCF is involved, and the DA's office is involved. It's great because you come in and there are different resources, and different things are evolving as all the time. Different groups are popping up that we may not be connected with. So it's a great opportunity for everyone to connect. So.
Thank you. A follow-up question so if someone in the city of Boston is experiencing domestic violence and then there are charges pressed against the suspect, they have a DV advocate from BPD.
Yes.
Currently we have 5. We're hoping to get full capacity at 7. When we get to full capacity at 12,000 a year, we'll realize that even 7 isn't enough to sort of do the work. But there's that. And then if it's actually a case that's moving through the court system, they also will have a victim witness advocate assigned to them by the district attorney's office. Is that correct?
Yes, ma'am.
And they work together. So,
yes, and identify any gaps or whatever needs they may have. The DA's office might have different resources than we have, so they work in conjunction. Yes. Just
to uplift the fact that if there's on one hand there's for some reason an advocate that doesn't know or is that capacity, you hopefully get from the DA's office. Between the two of them, the hope is that is enough to catch people and meet them and to help meet their needs. But we also know in practice that sometimes that doesn't always happen.
Yes.
Yeah.
And I'd just like to also add that there are victims that are very reluctant to report domestic violence.
Yeah.
But then there's family members that are really concerned about their safety. So if there's family members that are watching this today or listening to this, we encourage you to call the Boston Police or any of the external partners. We're there to help you and convince your family members that we are here to assist. The Boston Police Department are very well victim-based assistance, from our 911 callers to our police officers that respond to the scenes, to our detectives, our patrol supervisors, and even our advocates. So even after the 911 call is cleared and we leave the scene, there's someone available in the department to assist victims and victims' families. That the captain mentioned, sometimes there may be a victim that's reluctant to speak. What advocates can call us a victim that needs a ride to court or unable for transportation, or at 2 o'clock in the morning they decide they want to call the police to get a restraining order. We will call the on-call judge and we will assist them in getting that order, and we will find them a place to be safe. So I just want to make sure that there are those options and available stuff available.
One additional piece of a supervisor assigned to the domestic violence unit, one of their responsibilities is to identify, try to read through different cases. Again, a number of cases here through their case review and conversations with the detectives, try to identify, and we recently met with the DA's office with regard to this, is trying to identify the components of identifying these folks that there's going to be a problem later on. Is methods of figuring out how things escalate, and we're trying to provide that training and have those conversations with the DA's office so that when it goes to court, and they're very inundated as well, but when it goes to court, it may seem like a simple assault and battery, to them, but we've identified that this is habitual and it's only escalating, and there's going to be some issues later on. So we do have that communication with the DA's office as well.
Thank you. And I'm not sure if I have a bunch of questions. I will allow probably for my colleagues, and then I'll come back with my questions. I wanted to also just thank Dana Alice from the Office of Women's Advancement. I know that the director, Mendoza Arrejeta, talked about the work that she's doing in partnership, but really appreciate you, Director, for being here. And just wanted to clarify that, if 911 is the number that people should call if they're experiencing domestic violence issues. Is there a number short of that at BPD that folks can call if they're looking for resources? I know that there's a safe link with Casamina, but I'm wondering if there are other, is there another number that we give to folks who want to know what's possible?
The feel-safe is always 911, and we can have them directed directly to the FJC or domestic violence detectives, but at some point somebody will relay them to us anyways. There's no particular number, but I would stick with 911 as the most easiest way to get in touch with us. But we have clients that come in off the street, so one of the pieces of in the future would like to have an advocate actually on site, so that we do receive a lot
at BPD, at headquarters?
At the FJC, because they could work with human trafficking, they could work with sexual assault unit, and they could work with the domestic violence, crimes against children, everybody. It would just be a great resource to have. A lot of times too, folks may just reach out again, like the deputy had mentioned. There'll be family members that would try to intervene, and sometimes we can work with them as well. And to have that resource would be great.
Awesome, thank you. Councilor Braden?
Thank you. Lots of questions. Just briefly from the BPD point of view, in terms of District 14, D14, I heard from the Public Health Commission that we had a higher than average. Is that still the case? Or I know it was a few years ago we had that conversation.
I'm not sure. I don't have those particular numbers, ma'am. I apologize. I can look at those and get back to you.
Yeah. It's just, I think we have a sort of a transient community, and it's very hard to keep track of everything. The other question I had was just in terms of our immigrant communities, in terms of the current climate about fear of reporting, fear of drawing attention to themselves. Are we seeing a decline in reporting, or where is that at the moment?
No, not maybe within. We only have an idea of when the police reports come in, when they're calling 911. We're not sure, obviously, unreported, different things. When it comes to us, we're not exactly, that's not a question we ask any status, immigration status. That's not going to determine any resources that we have. We have particular resources that we can direct folks. So we don't, that's not even a question that we have. That doesn't impact our investigations.
I think that's a very important thing to stress, that if folks, regardless of their immigration status, if they're experiencing domestic violence or sexual abuse or whatever, that they should call 911, because
well, I think that the piece too with the FJC is that we have those non-government organizations that can deal with that.
Yeah.
If somebody doesn't feel comfortable calling 911 or coming to the police, that we have a very nondescript building and we have the resources there. So when folks show up, there's somebody there that it shouldn't have any impact. We try to make sure that nobody's concerned with whether they show up or not that have anything. But
that's fair. Thank you. The other thing is, with social media, this is more a question for Public Health Commission, just social media seems to has normalized a lot of violent, intimate partner behavior like strangulation and whatever, and it's really seems that how educating our young people and teaching them what's normal and normal's not the right word, but what's acceptable in terms of safety and engagement with your intimate partner. It's I don't know what in terms of the prevention line of approach. What are we doing? What are we doing with that?
That's a great question. So I'll start with within the Boston Public Health Commission's Child, Adolescent, and Family Health Bureau, we have a nationally recognized program called Start Strong. Start Strong does specific work with young people, and they have a social media campaign. I believe I actually spoke to them a week ago, and their social media coordinator talked about how they had like 9 million impressions, and they on social media. And something that, specifically what they do is do training and curriculum for young people around healthy and unhealthy and abusive relationships, what is consent, and then when we think about healthy, unhealthy, and abusive relationships, not just like romantic partners, but also when we're thinking about friends and just relationships in general. They're also doing a lot of work around boundary setting, empathy, social emotional learning, and so when in speaking to like the social media, yes, there is. There can be, we see a detrimental effect, but it could also be used as a tool of education and prevention. I know when I was speaking to the Start Strong team, Director Jess Alder, Janae, they spoke about when they're talking to young people, what they've been hearing is that there is an uptick in isolation and loneliness. And so and social media really being the one sort of outlet that they're able to connect with other young people, other folks. And so that is when thinking about sort of adapting the curriculum or adapting their social media campaign, that's something that they're keeping really in mind, because we know, teen dating violence in particular, and how it affects young people is really important. I know that the Mass Commission on LGBTQ Youth specifically, talks about recommendations to address violence, specifically around expanding sexual health education that is LGBTQ inclusive and consent-based. So I wanted to sort of uplift that report that they had for this year, because there's a lot of really important information there, especially as we think about the uptick in, I would say nicely, sort of the social political landscape and the impact that it's having on young people and on survivors as a whole. Does that answer your question?
Yeah, it does indeed.
Okay,
Thank you. And I'm just thinking about, safe spaces. I remember one thing that struck me very strongly was at one stage, way back a long time ago, they were going to close libraries, and there was a hearing at the public library and at the Copley Square Library, and a young woman stood up to testify about the importance of the library, and she said it was the only safe space that she could go after school until other responsible adults would turn up in the evening.
And
that
free.
was her haven. That was her safe harbor. I just thinking about safe spaces in our communities and working to really have folks know that those are safe spaces and that there's maybe resources there that they can tap into. Have you any thoughts on that issue?
Yeah, thank you for uplifting that. I think I really love libraries because of that third space that is free and accessible and safe. I know that there is when I go to my local library in East Boston, they have pamphlets and handouts, and they'll have sections around like healthy relationships. So I think that is a vital resource, not just for young people but for all of the community members. But I'm thinking about the ways we're expanding public education or education in public schools as well is really important. I know that that's something that has been brought up as I've been doing this sort of listening tour for the last 3 months with community-based orgs, with individuals. Again, keeps coming up and up. Is like, how are we even thinking about not just high school students, but middle school and even early education. So I work alongside early education providers around building their capacity to have trauma-informed and equitable daycare practices, as well as interfamily violence, and being able to see sort of those red flags and connect families that they may be worried about to resources that they need. And so it's not just sort of the public, it's where do people live, work, play, learn, right? And thinking about how we can spread that awareness, right? I mean, even thinking about the bathrooms here in City Hall, right? And being able to have like stickers on the mirrors of like, here, if something is coming up, are you fearful? Like, having that information easily accessible. I'm also thinking about the ways in which right, like building the capacity of those daycare workers. Is also thinking about building the capacity of housing providers, right? That they're solely focused on maybe on doing those applications, those housing case managers, but more often than not, it's gonna come up. They're going to interact with a survivor, and how do we equip them to feel prepared to say, I'm so sorry this is happening to you, and how can I bridge you to the resources that can really support you long-term in safety planning?
Council, first of all, I'm a librarian by training and by heart, so I deeply appreciate your comment. And when I go into the libraries in my neighborhood, Adams Village, Common Square, Lower Mills, Phil's Corner, and seeing resources and information right as I walk in that speak to safety and it being a safe space, as well as an educational space. And as Kim was talking, one of the programs in the office is the Capacity Building and Training Initiative, which is where Kim served before being promoted into this role. And they're doing training. It makes me think of how do we make the spaces we have safe or safer. So the Start Strong effort is in the schools. It's not in all of the schools, and so that would be an opportunity for expansion, but they're working in the schools with those students. They also have a strong social media presence. And you'll see their signs on MBTA buses. Are you is your friend in an unhealthy relationship? But the trauma-informed training that the Capacity Building and Training Initiative does allows providers, it could be early childhood educators, it could be city council staff members, which they've done. Could be other agencies, city departments in the mayor's office, about being trauma-informed as you provide care. They've done work even at the BPD Academy, right? So that the work, as you do your daily work in your organization, how can you make that as safe for yourself and for the people that you're working with? I also wanted to underscore all of the entities that are there in the FJC. This is going back to the earlier question. The district attorney's office is pretty, I would say, deeply is present. If there is someone that the CAC, Child Advocacy Center, is serving, and the family is there, and the young person is being interviewed, the building is designed so that the detective, the ADA, the victim witness advocate are all able to, and they're being interviewed by the CAC clinician, they're able to see that without having that child, that person, retell their story over and over again to 3 or 4 different professionals. So the building is designed for that. It means the district attorney's office is a part of the FJC. So if I say the FJC Leadership Council, the district attorney is and always has been sitting on that leadership council.
Thank you. Thank you, Madam Chair.
I just wanted to add one thing as well. I spoke with Superintendent Cologne a few weeks back. We have a great relationship with the colleges in Boston, and sexual assault recently was invited over to Boston University to sit in on something and have a table just where students could come through and get some information. They do an exceptional job with outreach, but we did identify that we're gonna do a piece getting together now. The commander of the domestic violence unit, she's on vacation right now, but she has some great ideas with what she wants to put together. So identify what relationships look like and healthy relationships are, I think. And we can kind of start with the college and move down. The colleges have great stuff. They're doing great things with their students and the outreach, and invite us to a lot of stuff, Northeastern as well. With regard to social media, we come across that quite a bit. Crimes Against Children has an Internet Crimes Against Children section within there, and Sergeant Detective Mike Sullivan heads that. He's been there for a long time, but he takes in a lot of referrals with regard to borderline, sometimes criminal stuff that's going on between young people on social media that may not realize that it's criminal. So he does a lot of intervention and diversion work with that. So we are well aware with that, and we devote a lot to that. And there's a lot of training that's available for that they take advantage of. So we're trying to keep up with a small unit. We're trying to stay up on that.
I really appreciate all that. It's like, as I said, it's the iceberg.
Yes, ma'am.
But thank you.
Thank you. I just want to mention we have been joined by Council Weber. Thank you. We're going to Council Flynn next.
Thank you, Madam Chair. Again, thank you to the Boston Police that are here, and also the Boston Public Health Commission team that is here as well. Exceptional work that all of you are doing. Thank you, Captain Thomas, for your testimony and for your work in this field for many years. Captain, you mentioned at the beginning you had 5, was it domestic violence assistants, and you were trying to get 7, is that?
Advocates, yes,
Advocates,
sir.
okay.
Currently, we're in the process in the hiring process, and
Okay.
we kind of evolved a few jobs trying to create that new one that I discussed.
Okay, thank you, Captain. Captain, if there comes a call into 911, someone reporting a sexual assault, can you kind of walk us through that call? Will go into the police station, or it won't go into family justice? It'll go right into a particular district. Is that accurate?
Yes, depending on how it goes. 911 will go to wherever the incident occurred, and then a car will get dispatched out.
And that's responded to by detectives at a particular district.
Yes.
And then when does family justice personnel come in?
With regard to that, when a supervisor responds, just how our protocol when somebody responds to a sexual assault, the supervisor will respond as well. At that point, they'll reach out. Sexual assault works 2 shifts, but they're on call 24/7. So anytime they're reaching out, they have somebody to contact, and they'll speak with somebody.
Okay. Oh, so they'll get a call, a sexual assault team will get a call if something does take place?
Yes.
And they'll respond, okay. So if they're on call, does that mean we don't have someone that's physically there all the time, maybe including the weekends?
They're there for, like I said, first 2 shifts from 7:30 or 8:30, 8 o'clock in the morning till about midnight.
Okay.
And then they're on call overnight. But it's staggered. It's not Monday through Friday. It's squads, so it's always covered, and somebody's always on call.
Okay. And then before I do get to Kimberly, just wanted to finish up, Captain. Tell me this, the challenge the police officer or police official might have if the survivor or the person calling seeking support from the police, if they don't necessarily speak English, they're concerned about, maybe they don't speak English, but they're also concerned about their partner who might be their spouse, and they don't necessarily want to get involved with the court system. How difficult is navigating the language, and what would you do, and how would you respond to someone that doesn't want to necessarily get their spouse involved?
Well, the language, fortunately, we have diversity within officers responding, as well as within the unit we have very different language being spoken. So that's not an issue at all. There are certain times where certain victim survivors will prefer to speak with, say, a female as opposed to a male. I mean, we'll make accommodations for anything. Once we get into that, we do have sexual assault with the advocates through the DA's office. You know, we can walk them through where if they're not ready to proceed with something, then we don't force that at all. You know, everyone's going to move at their own pace, and we respect that.
Maybe my final question, Captain, but what would happen if a survivor called that, say they spoke Cantonese, and maybe there wasn't anyone in Boston Police at that particular time that's working that shift? I know you might do a call on the radio, but if there wasn't a Cantonese-speaking officer, I represent, as you know, a large Cantonese-speaking community, but how would we go about ensuring the police would respond properly to someone that speaks Cantonese?
We have they have access to a language line where you could coordinate that way. When a detective's involved, they can reach out to that language line, or an advocate can reach out to the language line and handle it that way. We do disseminate information in hand and through all sorts of languages. But if there was anything in particular you were concerned with, any particular part of your constituents, you could reach out to us. We have, like I said, a number of different resources and service providers that we could connect with them.
No, thank you, Captain. And Kimberly, thank you for the important work you are doing. I know some of my colleagues, myself, worked on, and I guess my question is, have you seen, and I want to do a comparison, but have you seen an increase in maybe young women especially calling because of sexual violence as it relates to having their alcohol drinks spiked at a particular restaurant? And how would you respond to that if they don't want to go, if they don't necessarily want to go forward with within the criminal justice system, but do you have any challenges with that type of issue, and also comparing the intimate partner sexual assault as well? They may not want to go forward for various reasons as well. I guess my question is, how would you respond to that? Because especially when someone, well, certainly we never want this to happen again to anyone. So how would you go forward to ensure that the survivor continues in the community, in the criminal justice system, or to encourage them to go that avenue?
Thank you, Councillor Flynn, for that question. I don't know if there has been an increase in young women around having spiked drinks or date rape drugs. I know that I spoke to Director Liz Curtis, and she did mention that young women there has been an increase in calls coming in around domestic assaults for, I believe they're like the second highest, but we'll need to get that more concrete for you. However, I think in regards to date rape drugs or spiking of drinks, I know I was in the LGBTQ safety meeting, and they did mention that there was an interest in supporting trainings for nightlife managers and owners to be able to support just more of an awareness around that issue. And so with Detective Richard Dayhill, we are just starting to have those conversations around what that conversation or training might even look like around, especially with the Office of Nightlife. I think related to, or the next part of your question around whether a survivor or a victim might not want to go down the criminal legal route, I'll say this. When I do trainings around domestic or intimate partner violence, we have a section called empowerment-based advocacy, or a colleague in the city of Cambridge calls it GPS advocacy. And she calls it that because when you put in an address in your GPS, it tells you exactly where to go. It doesn't ask, are you sure you want to go down that route? Maybe down this route. It just tells you this is the sort of best way to go. It sort of gives you options around how to get there, but it doesn't question your decision to go to that particular location. And I use that as an example because as an advocate or as a community health worker, my number one priority is to lay out the options for the survivor, for the victim, and following the criminal legal route is one of them. And if folks or survivors do not feel comfortable going down that route, I wouldn't encourage them to seek something they're not comfortable with. However, I do think that laying out really clearly what the options are, I really liked your question around what does it look like if someone calls and they're asking that? What is that process? I think demystifying what the process looks like for survivors calling, what to expect. I think it's all part of trauma-informed care, right? It's being predictable, it's being consistent, it's being able to demystify and being able to give folks options and a voice. And so how do we respond to this in regards to laying out options? I think it always comes down to that that education and that prevention work.
Thank you. I didn't look up early this afternoon some of the crime stats, crime one, as it related to January 2024 to the present, April 2024. And then the same time, January 2025 to the present. So over those 4 months, or 3.5 months, I guess, period, rape and attempted rape stats have gone up, and domestic aggravated assault has gone up. Let me just ask, Madam Chair, do I have time for one more question?
Yes. You do.
Okay, thank you. I do a lot of work with the disabled American veterans, and I bring that up because I know that women veterans, I think about at least 1/3 of them report military sexual trauma in their life, and it's probably close to 60% if they reported it. And I know, and again, I'm just talking maybe just the VA, but I kind of want to compare it to the civilian side, like what you're doing. But one of the issues that we have in the VA system is a survivor, a woman survivor. They don't necessarily have the gender-specific medical care services that they need at the hospital. I don't know if that's the case. If that's the case outside of the military, I think it's obviously much better in the Boston hospitals. But my question is, what type of services and support do you provide survivors of sexual assault, not just during the criminal case that's continuing, but for an extended period, because that care is critical, that trauma really never goes away. But what is the medical community doing, or what is your team doing to ensure that that person has the access to counseling and medical services?
Thank you for that question. So I'll start with, this specific initiative is, right now I am a team of one, and soon we'll be a team of two as we're hiring a program manager. Our focus is going to be specifically around prevention, and so we're not going to be seeing or having a caseload of folks to meet or to safety plan or to be able to follow them and connect them to resources. What we are hoping to do, however, is to really help coordinate and connect to and create bridges across sectors between domestic violence advocates, community violence responders, and other allied sectors such as housing and mental health care, and really supporting the coordination of that and the connections between each is one of my primary goals as part of this initiative, because when we think about if a survivor has just gone through harm, the ability to sort of sit down and say, okay, I need to call this person, and need to call this organization, and maybe they have a wait list, and maybe they don't, and then if I call at this hour and this person picks up, so there's just so much that's happening in regards to just like the impact of the harm that has just occurred, plus the logisticals of getting connected to what they need. And so when I think about this initiative, it's really how are we building connections and establishing and maintaining those relationships to be able to support that person who just went through harm, and maybe they don't want to go the criminal legal route, but maybe they have in Massachusetts they have 5 days, if they were just raped, or they have 5 days to go and get a free medical examination to do the rape kit, and they don't need to do anything else, right? And just even knowing that that's a resource, that's available, and spreading that awareness is really important. But yeah, maintaining those connections and relationships across different sectors, across like the hospitals, and also when we're thinking about supporting folks, just even coordinating that is really important. And so I'm a proponent of community health workers for that reason, because they work across sectors and can really support and have that every step of the way for that survivor. Does that answer your question?
Yes, it does. Thank you, Kimberly.
Okay,
thank you very much. Thank you, Madam Chair.
Thank you, Councilor Flynn. We have been joined by Councilor Worrell. Thank you. Next is Councilor Weber.
Thank you, Chair. This may have been asked before, but in terms of domestic violence shelters, can anyone speak about what the capacity is, and whether you think we have enough capacity in the city, or is there a wait to get in, and how that's, yeah. So just.
Yeah. Thank you, Councilor Weber. I'm going to quote Deb from Brookview House and say, she said, we can't shelter bed our way out of this. And, she said that as we were having a conversation around what this initiative can do to support the work that they're doing. When we think about shelter beds, 99% of the time, and I'm making up that number, but like often, very, very often, they're full. And emergency shelters have, I know I was having a conversation with Reverend Margaret at the UU ministry in Roxbury, and they have, they run a shelter, and something that, they mentioned, they're like, we don't tell people that they need to leave, that we don't tell them that they have a time limit in staying in our shelter. And so when there was, and I know JDI is doing a lot of work right now in regards to really thinking about what are those housing options for survivors, because right now what we're seeing is that emergency shelters that used to be, between 6 to 8 months, somebody would get housed. Now they're in there for a year, 2 years plus, which then they're, often folks also don't want to keep wait lists, because if you're, a survivor, you put yourself on a wait list and somebody calls you at a time when you're with the person who's causing you harm, that can put you in danger. And so a wait list, I was speaking to Reverend Margaret, they don't like to keep wait lists because of that. And so sometimes, most of the time, what survivors need to do is they need to call every day, multiple times a day, to see if there's an opening. So have them to call the SafeLink line. And so, no, there's not enough shelter beds. And also, I think, again, as Brookview House CEO said, we can't shelter bed our way out of this. And so what are those expanded housing options? And that's part of, I mentioned in my opening statement around the plan to end violence work that we had been doing, and the support, and one of the proposals that is under my purview, and that I will be really championing, is how are we expanding housing options for survivors, and what that looks like. I know, and I'll mention JDI again, because I know that they're doing some work right now that was shared with like the DV Council as part of the City of Boston's Teaching Hospitals Council, that that this is a huge need, not just in the city of Boston, but in the state. And when we're thinking about not just those emergency shelter beds, but maybe housing incentives or incentives for landlords to be able to expand their availability for survivors. What does, expanding or creating vouchers specifically for survivors? So there's a lot of thought being put into this by experts, so I really appreciate that question. Thank you.
And just, sorry. Yeah.
So just to add, the feedback that I received from the domestic violence advocates is that it's a significant problem and there is a shortage, and particularly it's victim survivors with their children. That's a big obstacle that they're trying to get over. So it is a major problem.
And so do we, does the city put people into shelter? Like, how involved are, do you call up Casimir? I mean, how does it work? How do you connect them to a bed eventually? And can you find them beds outside of Boston? Just, I guess, walk me through that process. And I'm also, just for myself, my colleagues may already know, in terms of who's providing the shelters, are we relying on nonprofits, the state? What's the mixture? Does the city have shelters? Do we fund shelters?
Yeah.
Sorry.
That's a great question. So there are a multitude of ways that survivors can get connected to shelters. I worked as a community health worker for a long time, and so it is a mix of nonprofits that are funded by the state or the federal monies, and there's a lot to be said about that. And we're also thinking about the emergency family systems within the state of Mass, and so being able to go to the Department of Transitional Assistance and going through that whole process and indicating that you're a survivor, that you need support, and you have to have a specific income or less. You can't go over a quarter or $1 over that specific income, because if not, you're not eligible. And you have to have a family, our children. At least one child needs to be a U.S. citizen. So there's a lot, and I say all of that because there's a lot of it's a winding road to be able to get assigned or placed into a shelter if you go through the DTA route. Then, of course, there's the nonprofits that, again, you have to call SafeLink, and SafeLink is really where that's the hub. They'll know, they'll get a call from a shelter, and it's across the state, right? And so imagine if you're a survivor and you have a job to go to in Boston, but you need to go and they place you out in, like, Topsfield or Grafton, and you don't have a car, and so they might say no to that placement because they aren't able to get to their house or to their job, and they might lose that job, and then it's a whole winding road past of that. And so I think when we're thinking about supporting shelters, I know that the federal government sort of funding is a huge fear right now, and I think even something smaller. As I was sharing when I was speaking to Reverend Margaret, their shelter is in a Boston neighborhood, and their staff and the shelter residents get ticketed all the time because they're not technically right. The shelter residents are not technically residents of that neighborhood, and so they can't get parking permits, and they get ticketed all the time, and they're already in a lot of financial straits, right? And so when we're thinking about the shelter system, or like being placed in a shelter, something as small as a parking permit can really support that survivor. And also when we're thinking about the structural level of supporting and filling in those gaps when and if and when the federal funding may be cut.
Do I have time for another?
Time, yeah.
Okay.
Yes, you do.
Yeah.
I just want to add to that. It's a challenge for us, law enforcement, especially if an incident happens at 2 or 3 o'clock in the morning, but there's no space for a family. It would be nice if the city could partner with maybe one of the bigger hotel corporations where we could have a voucher system where we could get their rooms. I mean, there's been times where the officers are left with no other alternative, and they'll just pay to get them a hotel room to get them off the street for the night, especially if they have to go to a court the next day. So it is a challenge for us if it's 2, 3 o'clock in the morning and there's no close family members, or they're not comfortable staying with them, and they don't want other family members in their business. So it would be nice if we had another alternative within the city that we could help residents as well for emergency housing.
Okay, and then shifting gears a little bit, just in terms of stalking, what does BPD do? What's your, and I'm happy to hear from everyone. How do you approach that? What has to be? Do you feel like we have enough? Do you have enough tools if somebody's just being stalked to step in, or do you have to? Walk me through what it's like.
Well, I think
dealing with those calls.
It starts obviously with a police report. Somebody can come in and say, here's the situation. Some people have different ideas of what stalking, harassment, different things, but when it comes to the law, what is required, the elements of that crime or anything. So our detectives are versed in all that. So they'll work with and figure out exactly what the cases are, what the charges, the proper charges. Again, consultation with the DA's office, here's the situation, and so they'll walk right through that, so they'll have the idea of here's what you can't do. Nobody's going to be turned away from any resources based on that it's not technically a crime what's occurring. So we'll go through it, and the detectives are versed in how to actually, go to the courts and seek the proper charges.
Okay, yeah, and anything else? Okay, just one last thing. In terms of affirmative, I think you mentioned outreach, but to immigrant communities here in Boston who may feel right now if they come forward they'll be put on a plane somewhere, and or that their partner may end up sent to El Salvador or something. So what are we doing, if anything, to communicate with those communities about to encourage them to still report or come to us for help?
Well, I can say right now that we don't ask anyone their immigration status. Someone needs assistance, no matter what that crime is or whether it's not a crime. The Boston Police Department and obviously members in this room, we're here to help each other out.
Yeah, no, that's great. I'm just, I'm just asking, I think we're all on the same team here, and I just was wondering what we're doing in terms of, like, affirmatively letting people even know just that. Like, how would you know that, you know, if you were at home?
Another piece of that, excuse me, is that just we're relying on relationships that we've created over time in the community. With regard to community service offices, we have now community engagement. Those are things where hopefully we built some rapport with folks, and they know that they can trust what they can come and report or something like that. So.
Thank you. I'll also add a little bit about myself. I'm a child of immigrants. My parents immigrated here in the 80s, fleeing the Civil War in El Salvador. And I grew up an American citizen, and there was still a deep inserted fear, intergenerational trauma that this is not to say blaming BPD or any particular person in BPD, but sometimes we might not be able to sort of overcome those fears in people. And so where I encourage folks is laying out a menu of options, right? Being able to say, this is how, if you want a restraining order, or if you want to report, this is how you do it, this is how we demystify it. Being able to have those connections and community relationships with the community officers is very, very vital and important, and only one piece of that menu of options. Sort of another piece is working alongside immigrant serving organizations who have those really deep relationships and connections, and being able to support them and being able to demystify, like, hey, you know, Centro Presente in East Boston or the Brazilian Worker Center, right? That they have those deep-seated relationships with the immigrant populations, and they're able to be that conduit, the trusted people that they can support through any sort of decisions that they want to make, especially as folks who are, you know, immigrants, who are survivors, who are afraid. They might never ever go to the police, and that just not part of their menu of options, and that's okay. And being able to support with other resources and other options for them is really where I want to sort of emphasize for all of us, is to be able to not sort of try to push survivors to only seek the criminal legal system options, because that is only just one of many, and every person is different. The way trauma affects every one of us is different, and so we have to be as a plethora of options as possible to be able to meet people where they're at.
Okay, yeah, thank you, Chair.
Councilor Rob?
Thank you, Chair. I know from a previous hearing on the VAWA stop grant, we heard from officers that there are only 2 domestic violence and sexual assault advocates covering all of Roxbury and Dorchester, and that was through the ARPA grants, which of course will be coming to an end soon. And we only have 5 advocates throughout the entire city. Is this still the case? And how do we plan on supplementing for the ARPA dollars?
With the VAWA grant, is that what you're referring to? Yeah.
VAWA, yes.
So with regard to the VAWA, we had 2 advocates that were on the VAWA grant. We took them off the VAWA grant and put them into the city, onto the city payroll, as through attrition to retirements over that time, and we moved the 2 other advocates onto. We're applying still for another position with that. We currently didn't create a position, but there was another position that was unfilled. We're currently trying to fill that for an advocate position, and I'd said earlier we're looking to try to create another position at the FJC. In particular, have the advocate work directly there, and it's any clients off the street, phone calls in, or even coverage if an advocate is on vacation or something like that, they can cover. A lot of times, that's what they do. They're covering certain areas of the city, and if they're not working or whatever, somebody else will assume that workload.
Got it. And there's two, just to be, for my clarity, there's two on the operating budget, domestic and sexual advocates, violence advocates.
They went from, two of them went from the VAWA grant onto the city.
operating. All right. So how many in total?
So
On just the
total,
operating, just on the operating?
6.
6, okay. Awesome. And are they, is it 24/7? What's their schedule?
no, during the day, 8 to 4, something.
8 to 4. And in terms of like the data around when, and I know it happens at all sorts of hours and times, is there a need for, us to revisit on when those advocates are on call? Like, should they be on call in the evening shift as well, or?
We've never really looked at that. It's always been a case of they're assigned those cases the following day when the reports come in.
Okay.
But that's something that we could definitely look at.
Awesome. And I guess I would like to learn more on the follow-up when a survivor experiences domestic or sexual violence. Can you talk to me about the follow-up that the police does? Because oftentimes you could see the survivor going back to the abuser, and just a story that an incident that happened over the weekend was, a survivor going back to the abuser, and it resulted in it was definitely tragic, but it could have been very much worse. So can you talk to me about the police's role on following up with the survivor to ensure that, everything is still safe for that survivor and that they're in a good space?
Yeah, like I said, they'll oftentimes with the domestics, the advocates will be some of the first people to reconnect from the time that the incident occurred, or if it's an arrest, or if an incident over, say the previous night, say it was the situation that you're, I think, referring to. It was at night, Friday night, and there was some contact made. Our arrest, I believe, was made on Friday night, and then there was some contact made on Monday morning from our DV advocate. Then Monday night, another incident occurred.
Right.
From that. So there was connection. Unfortunately, not always are we able to connect with the actual victims of the incident. They'll reach out if nobody will leave a number of messages or different, and different people have different timelines as far as whether they're ready to speak with us, whether they want to have those resources. That's not something that we can push. So we attempt at several phone calls. If we're not successful with that, we send out a certified letter with just information for that and any other follow-up. Again,
And are home visits part of your protocol?
No.
All right. Yeah, I would encourage home visits to be part of the protocol, just to check in with the survivor.
That can escalate the situation. Sorry.
I was going to say that.
I think with home visiting, just being really careful, especially if they're part of the police, just because it could escalate the situation for the survivor.
Yeah, maybe it's from when someone that you guys are organization that you're partnering with. But I do think checking in. I would just thinking about that incident. I think it could have been, not saying it could have. Not knowing what time that person would have been there, but I think it could be very helpful, just someone checking in on the survivor, being part of the protocol. And it doesn't, like to your point, it doesn't have to be the police department. It could be one of the nonprofits. Can you tell me how many trained sexual assault nurses and other staff in the healthcare industry are at each hospital? Do you guys have that information?
Yeah, we don't actually have the exact number, but I know as time's go on, certain hospitals are adding additional SANE nurses to their specific areas. I know, I think the East Boston Health Center just recently hired a SANE nurse there. Tufts Hospital, same thing. So as we go on, they definitely have been adding SANE nurses throughout this particular region, I think throughout the state of Massachusetts also.
Awesome. Those are my questions, and thank you.
Thank you. We'll go to a second round if any of my colleagues have questions. So, Jen?
Thank you. I want to thank my colleagues for asking really great questions, some of them which were on my list, and I'm eager also to get to the advocates because I think that they'll have a nice response and it'll be a nice dialogue, especially, for example, on the question of immigrants and how our immigrant communities are feeling, because there is that was my biggest fear with the change in administration, that people who already are feeling vulnerable are less likely to make contact with police officers in domestic violence situations. And so I'm glad to hear that we're not experiencing at this moment a downward trend in reporting, but I hope that's something that we can keep a pulse on, and I'm sure our advocates will have information to share about that. And I'm hoping to, so a lot of this is me questions and just statements in terms of what I've been hearing. Director Mendoza had to, hopefully in the data collection work that you're doing, I know that, and I appreciate that the police don't ask people, the immigrant status, it doesn't matter. You respond to people as they need help. I do believe that if there's a way in the data for us to track that, or to find out, or to try to get that information, it would be helpful for us to understand, to disaggregate the data and see what's happening. So, and also to better target the public awareness campaigns that are happening on the TU or in different places, because I think that there may be, when you disaggregate the data, there may be trends happening that we don't see. And so heavily in the data collection, I think a lot of the work that we do sometimes is about how are we letting people know that there are resources available, and specifically from the city. But I think the public awareness campaigns can be hard to target if you don't know if you're not capturing the data and following what the data is showing. I want to thank Council Weber, who asked the questions about stalking. When I sponsored this hearing, I immediately got an email from a constituent who said, will you please make sure that you talk about stalking during this hearing? And so I wanted to thank Council Weber for asking that question, but to also, if someone, I'm not sure, maybe it's you, Lieutenant Detective Texera, or whoever, can talk about a specific situation where there is a case of stalking and the resources, the tangible resources that we were able to provide, or if there's anyone from the advocates panel later that can speak to that, that would be really helpful.
I mean, in terms of us with the sexual assault unit, obviously we more on the side of people reporting the sexual assault, either it happens, so this is, we're getting the information, after the incident, where they might provide the information of previous instances that happened in terms of our unit. So we really don't get the front end of it until we actually have someone who might come in and provide their information of previous interactions that they might have had with that individual that kind of led to the situation that they've gotten at that point.
Thank you.
If you want to connect us particularly, sometimes there are facts that we're not aware of. So whatever that circumstance might be, if you have somebody in particular that you'd like to have speak with us, or if you want to connect us, we can provide some services.
Thank you. I'll reach out to the constituent to see if that's something. I think there's so much stigma, and I think this goes to the. Did you say that the commander of the DV unit is a woman?
Yes.
As well? And so I'm happy to hear that. I know you all are great at your jobs, but I also think that there's a lot to destigmatize, to make people feel comfortable make sure that we have a good units where there are a lot of women officers, where folks feel comfortable with those interactions, more comfortable. Will also really help with the destigmatization. So I appreciate you for offering, Captain Detective Thomas, right?
Yes.
For offering that, and we will, I see Jesse from my team, make sure that we reach out to the constituent to make sure that we can put them in touch if they would like.
And again, even if it's not a criminal matter, there are still resources that we can provide, and there are referrals. So
Okay.
we deal with a lot more than just the criminal piece.
Great, thank you. And then lastly, I guess what I'll say is you know, there was the tragic incident in Mattapan happening earlier this week, and I think one of the things that we want to make sure that people feel like stable, and there's a big financial component to domestic violence that is really hard to address. A lot of that is in creating stable housing options. So another thing that I'm looking forward to, you said JDI, like I'd love to see comprehensive information and data around the housing challenges that we face when placing folks who are experiencing domestic violence. I know that at the BHA level and at the state level, there are priority for those who are experiencing domestic violence. To hear about the increase in wait times in a shelter is disheartening to hear, but there's more work that we can be doing here at the city, hopefully, to sort of get at that gap. But I think, again, it requires data. So I look forward to sort of either if it's coming from Jane Doe or it's coming from you or a partnership to really having a better understanding of the housing needs and how we can meet those. I just want to thank everyone for your work and for being here. I know it's incredibly difficult work, but it's important for our survivors. And I appreciate the elevation of like what would it look like to have a victim advocate in BPD headquarters to be able to be responsive to the issues. And we're in budget season, so I think that's an important thing that we can talk about, because even 7 victim advocates for a city of 700,000, when you're getting 120,000, 12,000, approximately, and those are just from the people calling, that expanding resources is really important. And so thank you for giving us something tangible that we can work on and work with. Appreciate that.
Thank you.
Thank you. Councilor Flynn?
Thank you, Madam Chair. I represent in District 2 a large LGBTQ plus community in my neighborhood in South Boston, the South End, downtown Boston. What type of support and services are we providing survivors of domestic violence or sexual assault that's unique to that community? And is there anything that we are not doing to support them at this time that maybe during this budget process it might be helpful for me to advocate for, whether that's in the public health field or that's in the criminal justice field?
Thank you, Councilor Flynn. This is supremely important. I do want to highlight and emphasize the Family Justice Center partner, the network La Red, who does a lot of work with the LGBTQ community. And they published a report in 2019, so this was right before the pandemic, but they were specifically looking for an understanding of what the LGBTQ community was looking for. What were the prevalence and the challenges around connecting to resources? And so they had over 3,000 respondents, and one of the sort of key findings that they had was that there was a lack of, or sort of a need for us to build a capacity of providers, not just within, right, we know the Network La Red is sort of the leading organization supporting LGBTQ folks, but also when we think about other organizations, how are we ensuring that we have LGBTQ trainings and competence, understanding different tactics of abuse and barriers faced by LGBTQ survivors, and also thinking about how are we leading survivor-led supports and services. And so some key recommendations that they had were increasing survivor-led community organizing, engagement, and awareness campaigns, supporting mainstream programs, and becoming culturally competent and accessible to survivors. supporting the LGBTQ youth with youth groups, school-based supports, survivor leadership, so encouraging survivors to hold leadership roles in their communities, really having an expanded analysis of partner abuse, so including all forms of systemic oppression in the analysis when we're looking at data, and really increasing funding for LGBTQ-specific DV organizations. And I would, again, always come back to that education piece and building capacity for not just specific LGBTQ serving organizations, but for the broader, for hospitals, for folks who are interacting with in schools as in particular. So there is, there's a lot to do there. Does that answer your question?
It does. Mark, you were going to say something? It does, yeah, thank you.
BPD might pick this up, but Deputy Superintendent Dayhill, whose name was mentioned earlier, hosts a monthly meeting for the LGBTQ plus around safety, the community. So in a number of the Civil Rights Unit with the BPD, we did have participation from the U.S. Attorney. We've not seen them much this year, I'll say. And a very good number of community organizations that are supporting and representing the LGBTQ plus community, as well as the mayor's office for LGBTQ plus advancement. And so this gives us a way, the way we kind of get things done in the city is it's all these partnerships, government, non-governmental organizations, but with the police hosting this meeting, it's been going on for some time, and I'll say it's a meeting that I've seen improve over the course of its history, and I think that's happened because the advocates and the service providers are engaged and speak up. We need this meeting to be structured differently, and then like this, and then the police, particularly Deputy Superintendent Dayhill, has been very responsive to that. Mm-hmm. And so it's a good meeting, and it's a good way for all of us to be able to be regularly and systemically together at the same time.
Thank you, Mark. Appreciate your response, and I also know the great work Deputy Dayhill does throughout the neighborhoods of Boston. So thank you for the Boston Police team, for the public health team. My final question or comment is, one of the first meetings I had when I started 7 years ago is I met with the Asian Task Force Against Domestic Violence, and I think they're going to be speaking shortly. And one of the questions I asked, I'm just trying to remember back, or if it was brought to my attention, I forget exactly, but the one of the biggest challenges they faced, or an organization faces, is language access. And that was the first question I kind of highlighted. And I brought that up because in the Asian community, there's not just 4 or 5 different languages. There's, I might be exaggerating, but there might be 50 or 60, 70. And people would come to the Asian Task Force Against Domestic Violence, a survivor, and maybe they don't necessarily speak the language that the person speaks there. And so I think about that because I also think about the Boston Police, and certainly the language access system, computer system, that works, but that's not exactly talking to someone directly. But recruiting people that speak various languages is critical in city government. But I go back to my question about language access. So what would you do if you had a survivor of domestic violence? And I know I asked the captain this, but what would you do if you had a survivor of domestic violence that you had challenges with language access issues? Certainly, I know there's various city departments that have people that speak various languages, but not all the time, because I know many people, I know the departments, and not every single department has someone that speaks Cantonese. for example, in including major departments. But what would you do in that type of situation when you need immediate assistance from someone that speaks Cantonese and that person is just not there? And I guess it could be open to anyone. I don't really want to put anyone on the spot, and I know Kimberly, you're doing an excellent job, so I don't necessarily, whoever wants to take a shot at it.
Well, with us, with the police, we partner with other law enforcement agencies, so if that were to come up, we would reach out to other law, whether it be the transit police, the Massachusetts State Police, or any bordering law enforcement department. We all work well together with conducting mutual aid. As you can see, during the marathon, we had abundance of different law enforcement agencies assisting us. So if it came down that there wasn't anyone in this department, even though we have a very good, diverse department, we can reach out to our external law enforcement partners for language assistance.
Thank you, Deputy. And so what you also highlighted, Deputy, is the working closely police departments across Greater Boston to solve crime, but also to support survivors of crime as well. Is that accurate?
Yes, yes, it is accurate. Yes.
Thank you. Madam Chair, I have no further questions. Just want to say thank you to the panel that's here for the outstanding work they're doing.
Thank you. Council Weber, do you have any more questions for this panel?
Yeah, just one. I guess if anyone wants to highlight like a tool or something, we mentioned briefly vouchers for emergency housing. Like, is there something that you wish you had to offer, they have in other cities, or that you want to highlight for us?
That is a great question. I think especially as it relates to housing, expanding housing options. I know landlord incentives, vouchers, but also just starting that conversation with thinking. I know there's a proposal right now around expanding housing options that we've created as it relates to the plan to end violence, and more than happy to sort of share that planning that went into it, and the hope that we have. I think particularly around thinking how we can support the Office of Housing here at the Mayor's office to partner with them to be able to really flesh out what housing options and expanding that, whether that's landlord incentives or vouchers, can look like. And so there's a proposal sort of ready to go for that. And then something small, I'll just reiterate what Reverend Margaret said about those parking permits for their shelter residents who are getting ticketed every night, and they have to pay for that. And so if there's any way that we can even sort of start creatively thinking about what are the options for those for those staff who have to be there overnight, or specifically for the residents who have to live there but are not technically residents of that neighborhood. I think that is something small that we can think about that would really impact and support the work that they're doing.
Okay, thanks. No, Chair, thank you.
Okay, thank you. Council Royal, you good?
No further questions. Thank you.
Okay, thank you. I just have a couple questions for this panel before we move on, and I'm looking forward. Thank you to the nonprofits, the other, non-administrative panelists who have held on. Looking forward to your expertise and talking to you soon. A few things. If we're talking about domestic violence and sexual assault, and there's legal definitions, there's medical definitions, there's cultural definitions. If the police could define what you guys consider it, and if the public health could define what the medical terms are, and we all know that different neighborhoods and different cultures have different feelings and ideas around it also, and how do you support, when do you step in? And because sometimes, like we say, this is a tricky situation where sometimes people don't want to report it, or they don't want to go forward with, having someone arrested, but at some point, if someone's committed a crime, they really don't have the choice to not get arrested because the person they harmed doesn't want, something to happen to them. So if you could just talk about that.
I think the simplest answer from our standpoint is just the law, the statute. That's pretty definitive. How we proceed from there, if there are different things with regard to speaking with the victim or survivor of an incident, how they want to proceed, that's obviously something that you'd speak with the district attorney's office and try and work through that. Again, we're not just looking to build criminal cases. We're looking to support. So however that looks, I think there are times that, yes, it is, we need to take action, and if that's an arrest or criminal case, then that's how we're going to proceed, but that's not always the case. So I'm not sure if that answers it.
No, that's helpful, thank you.
Okay.
Anything from like the healthcare, medical side?
Absolutely. So we also base, when we're thinking about the definition of domestic or sexual violence, you're absolutely right in that there are many definitions. I am a trainer, and so when I think about supporting just how we are building shared language is really important, which is why I brought that sort of one-pager around what I'm meaning when I say gender-based violence. When I do trainings, I don't sort of just like copy and paste what the law says is the definition, but I think it's very important for us to keep in mind. I know there was a new update to the definition, specifically around coercive control, and so I'll just say the definition that I use in the trainings is really that a pattern of controlling or threatening behavior meant to have power and control over someone. And we also have, like, very in simple terms, when there's power, when there's control, and there's fear, that is sort of the recipe for abuse. And then, of course, when we're thinking about sexual violence, is any sort of threat or act against someone who is, there's no specifically, I think, rooted in non-consent. And so we're specifically thinking about how do we make this, building shared language as accessible as possible. And sometimes legalese or, what we use in the legal or healthcare settings might differ between organizations or organizations. So I think that's, even when we're thinking about the data collection piece, that's part of the challenge that we're foreseeing. That's how we define it. Thank you.
Thank you. And I know since I've been here on the council, we've had many conversations about this topic and like which committee it falls into. And I know when we met, we talked about this, how, it could go into public safety. The topic, the conversation could be under public health. It could be in my committee, Strong Women, Families, or Communities. It could be in housing, city services, and so it's definitely a topic where it's like all hands on deck, right? We need all city departments. And even when you were describing, even within the police department, you have your departments within your own department that have to work together. And so it is, a big issue that we all need to be on the same page. And I know that we are here in this room, we're definitely doing that. So thank you for that. I'll just end with asking, what do you feel is missing? Like, if you had something else. And thank you for bringing up how you switched over some of those staff that were on the grant. Councilor Flynn, last month we had people in from the Family Justice Center and your grant writer talking about how one of the grants will end at the end of the summer, which is funding 2 of the staff members. And when it's a small department, 2 could be, half of your staff. So safely shifting them onto the operational budget is one way, but if there's others that you can think of that we can help, especially going into budget season, to advocate for things that you feel are very tangible that we could help support, that would make it better for you to help support these victims.
I can start. So I think I mentioned in my opening statement that we really thinking about hoping to identify additional funding or financial resources to support developing a risk assessment and a safety planning tool that takes into account community violence as well as domestic violence. And so that will allow for an evaluation to be able to, so a lot of our safety planning tools have been been evaluated in many years, and so how are we sort of staying up to date with what culturally society we're changing, and so, and especially as we think about the co-occurring or the interconnected forms of violence, how are we ensuring that the domestic violence advocates and community violence responders are also are being trained and being given the tools that they need to be able to identify the risk factors that come with both of those forms and that are often coming in together. And so really thinking about developing a risk assessment and safety planning tool is really important. So thank you.
On the, go ahead, Mark. Yeah.
I would just say men. Working with men who have caused the harm so that we're shifting people, giving people other ways of dealing with disagreement, mental health. So working with that, men as allies, and this may come up with the nonprofit organizations because there are a number of efforts there around how to engage men as allies. And then there are also cases where men have suffered in partner abuse in a relationship. So, and going back to allies, even if I think about my son, his friends, young men that are in the church, my responsibility to communicate to them that this is the right way to interact with someone who's very important to you.
Thank you. Are the domestic violence advocates the same as the social workers that we have? Do you consider that the same position?
Yes.
Okay. Because they did mention that we don't have funding for one at every district and that they base that on like the calls that come in. So which neighborhoods, which police departments don't currently have an advocate on staff?
No, they just spread the work among the 6 of the 11 districts. They'll do it that way.
Okay, so they're not assigned specifically.
You know, certain areas are going to be busier than other areas, so.
Okay. So they might spend more time, but that's because they're getting more calls there, but
They might have 2 smaller districts as opposed to a larger area.
So they're all covered.
So we just try and even it out so there's the workloads passed along.
Awesome. Okay, I appreciate you all for being here. We're going to call down the next panel, so thank you very much for all you do. Thank you. So the next group of panelists are Georgia Thomas Diaz, Shakira Robinson. You're here, you can come on down. Dawn Sama, Deepali Gulati, Karen Dahl, Nathia Badranath, Ruth Sakaran, and Carlene Desiree. If you're here, please join us. We can pull up another, is there enough chairs for you all? Perfect, okay. And if you don't mind, you can share microphones. So thank you for being here. Thank you for the work you do. Once you settle in, if you wouldn't just mind starting introducing yourself, where you're from, and then I'll give you time to speak. Thank you.
Good afternoon, and thank you
for having us. My name is Shakira Robinson. I am the CEO and founder of Shakira's Story Domestic Violence Consultant and Coaching. I am also a survivor turned advocate from the Dorchester area of the city, and happy to be here.
Thank you. Thank you for being here.
Good afternoon, and thank you for having us. My name is Ruth Zachrin. I am the CEO of the Massachusetts Coalition to Prevent Gun Violence. Prior to that role, I spent over 25 years as an advocate for survivors of domestic and sexual violence.
Thank you.
Good afternoon. Really grateful to be here. My name is Nithya Badrinath, and I'm the Policy Director at Jane Doe, Inc., the Massachusetts Coalition Against Sexual Assault and Domestic Violence.
Good afternoon. Thank you for bringing us here. My name is Dipali Gulati. I'm the Interim Executive Director at Saheli, providing domestic violence and sexual assault services for immigrant women from South Asia and Arabic-speaking Middle Eastern and North African countries. Thank you.
This one. Good afternoon, everyone. Happy to be here. My name is Colleen Desiree with the Association of Haitian Women.
Thank you.
Good afternoon. Dawn Salma, Co-Executive Director of the Asian Task Force Against Domestic Violence.
Awesome. Thank you. So we have a wonderful panel here. If you would like to start, and we can all just talk about the work you do, and then my colleagues and myself will have questions for you. Thank you.
So good afternoon, everyone, once again. I will speak from the reference point as I said before, the founder and CEO of Shakira's Story. I'm here today to uplift the voices of those who are not in the room, more specifically survivors of domestic and sexual abuse across our city. In specific to that, I would like to bring into this space teen dating violence and those who are impacted by that. I heard earlier today from the panel from before in reference to the LGBTQ community, so I want to make sure we uplift those members, and also to the members of our elder community, and also those who are representatives of the immigration community. I think I would like to start off by stating that including victims, survivors, and domestic abuse advocates at the forefront of legislative changes that shape the outcomes of their lived experiences not only cultivates opportunities to empower individuals to be part of the changes they seek, but it also amplifies self-efficacy in doing so. This survivor-facing approach also helps to change the narrative for many experienced domestic abuse and the legal system simultaneously for the first time. Storytelling is a form of healing for many. When survivors are provided with safe spaces to tell their story, and such spaces are inclusive to their emotional and mental health well-being, there is a likelihood that they are providing substantive context that broadens the facts and circumstances regarding the impacts of domestic abuse. Increasing the education and cultural competency of victim witness advocates, also known as VWAs, across municipal and state court systems could help save the lives of those who attempt to safely escape coercive and abusive behaviors by seeking a 209A. VWAs who spend time outside of the courtroom and strategize on coalitions and advocacy groups such as TRAC, which was developed to increase a deeper understanding of the complex, challenging, and unique dynamics of intimate partner violence. Community engagement with such entities should be a mandatory policy that ensures that VWAs adhere to ethical practices, are updated on current community-based initiatives and projects directly related to their serving populations, and are more intentionally involved in the processes that necessitate comprehensive and culturally sensitive systems. Domestic violence is a public health issue. It is a crisis that is impacting communities across our Commonwealth and across the country. By increasing awareness and communication concerning domestic violence, we will increase the opportunity for individuals of all ages to not only access support if they are experiencing domestic violence, but also to speak up for the first time. Domestic violence is at the root of a vast number of community violence events. If we could decrease incidents of domestic violence by increasing support to both victims and victimizers, we can improve safety in the community on a larger scale. One of the misconceptions, or a few misconceptions I would like to address about domestic violence and intimate partner violence, is that recognizing that it is a global public health crisis that affects communities, individuals, and marginalized populations and districts in distinct ways. Therefore, it requires a multifaceted, multidisciplinary approach that is culturally appropriate. DV and intimate partner violence can happen to anyone. This is not a woman's and girls' issue. This misconception about why it happens and who is most vulnerable is a critical barrier that drives a person's decision to seek or deny help. DV is considered one of the most common types of violence against women. A misconception here is that physical violence is the most prominent harmful aspect of DV or intimate partner violence. Many survivors would say that the psychological damage just might be one of the most complex forms of abuse. Trying to conceptualize the emotional damage one has caused is oftentimes taxing on the victim. Trying to recall or disassociate are two of the common themes that we see. Domestic violence is not a high conflict incident that will resolve over time on its own. Let's look at the power and control wheel dynamic in itself. We might better understand just how critical emergency responses are to the issue, how much the social determinants of health intersects with the psychological implications of abuse on both sides of the problem. The misconception is that victims who do not get up and leave immediately are choosing to stay in such an environment and disregarding the impacts that familial, cultural barriers sometimes keep victims in cycles of abuse, even after said abuser leaves. What my team has been learning through the voices of Boston Public School and higher education scholars across the spectrum of both social justice and education and public health aspects are that students and young adults do understand what abuse looks like, and many are seeing or experiencing it firsthand. Most know where to go, but they don't have access to resources in their school or communities. Highlighting the need for early and consistent education, acceptable mental health support, and adult allies who truly listen. Students want to know what they are not. Students want you to know that they are not just victims or bystanders, that they're active participants in the solution. On behalf of those who are not in the room today, it is time that we meet them where they are. Domestic abuse is a public health issue that continues to plague the lives of those who's impacted by its convoluted phenomenons. Domestic abuse, teen dating violence, violence against women and children, are all forms of violence that these survey results underscore to be a hard reality for so many. I would also like to bring to the table the uptick in CSA, which is child sexual assault cases against boys and young male adults in particular. Our organization has received multiple calls for support from parents and community leaders who have been informed of school-age boys reporting incidents of either rape or intimate partner relationship with adult males where violence and coercive behaviors are characteristics of their relationships. When it comes to survivor support, our municipal court systems currently do not have systems in place that actively support victims seeking 209A orders. BPD and VWAs across our experience in navigating survivors to safety do not work in tandem. To de-escalate or to find safety measures to help victims directly identify wraparound services, as we heard before, outside of their hourly operations. Our team has assisted BPD in relocating victims of abuse both within the city and those whose cases are so severe that fleeing the state are the best options to attempt intervention at the preliminary phase of survivorship. When it comes to reporting incidents of abuse, victims are less likely to report to systems where there is a high level of distrust or mistrust, systems that they have already navigated in the form of the school to prison pipeline, the sexual abuse to prison pipeline, or community violence. We have noticed that there is an uptick once again in child sexual assault cases. As we saw this weekend with the incident that happened in Mattapan, domestic violence is an issue that has not changed at all. There are multiple systems here today or resources here today that are answering the call to action, and you're going to hear a common theme that we cannot do this without the city. Thank you for having me.
Thank you very much. Thank you for uplifting our seniors. I'm glad that we'll be touching on that with this panel. Thank you.
Good afternoon. Again, my name is Ruth Saccharin, and I am the CEO of the Massachusetts Coalition to Prevent Gun Violence. And I want to start with some gratitude. Thank you to City Council President Lujan, to Chair Murphy, and to Councilors Flynn, Worrell, and Weber for being here and for having this conversation today. A part of the solution is having the conversation. As we always talk about in this movement, violence thrives in silence. And this helps us turn the volume up, and I appreciate that. As I mentioned before in my introduction, prior to taking on the role of the first executive director, now CEO of the Massachusetts Coalition to Prevent Gun Violence, I spent over 25 years working with survivors of domestic and sexual violence, as well as their children, as well as perpetrators of domestic violence. It is this work that brought me to the gun violence prevention movement, specifically my experience supporting children in the aftermath of a domestic violence homicide. For the 11 years I worked in Brockton, we were the program that held children in that immediate aftermath, that worked with them to process the loss, supported them at the funeral of their parent, as well as provided services to them long-term afterwards. And it really was sitting in close proximity to that trauma that got me thinking about the role of guns when we think about domestic violence. And I'm here today to speak to that lethal intersection of domestic violence and easy access to firearms. I carry the stories of survivors with me, and I carry the stories of those children with me. And I know that these stories are all too common. To frame the issue, our friends at Everytown for Gun Safety estimate that every month in the United States, an average of 75 women are shot and killed by a current or former partner. That is an alarmingly high number. So many victims, and the children that they leave behind are also victims of that violence as well. And nearly 6 million women reported having a gun used to threaten or harm them by an intimate partner, current or former. We also know that access to a gun or the presence of a gun in the home where domestic violence is occurring makes it 5 times more likely that a woman will die at the hands of a domestic abuser. To put it simply, domestic violence is a gun violence issue, and gun violence is a domestic violence issue. In addition to the tragic and preventable deaths and the overwhelming amount of trauma caused by the lethal intersection of domestic violence and guns, there are some other issues that I do want to highlight. As others who respond to violence in the community know, and this was talked about in the last panel, conflicts over dating partners often spill into public settings. Community violence is often very much related to domestic violence, relationship violence, and dating violence. Incidents that are classified as community violence are often violent encounters that evolve from conflict over romantic relationships. I know this anecdotally, but I worry that we aren't doing enough to fully examine or quantify that. Domestic violence also plays a role, a foundational role, in mass shootings. A recent study from Johns Hopkins found that 59.1% of mass shootings that occurred between 2014 and 2019 were domestic violence related. Somebody went after a current or former partner or a family member and also ended up shooting, wounding, and killing others as well. And in 68.2% of mass shootings, the perpetrator of that shooting killed at least one partner or family member, or also had a history of domestic violence or violence against women. There are so many reasons why we must look comprehensively at domestic violence, community violence, and gun violence. And I'm here to advocate for breaking down some of the silos, because too often we put those things in one category or another. I want to give one example. Many years ago, it wasn't here in Boston, but it was here in Massachusetts. There was a man who shot his wife, his children, and then himself. 5 people in one family died, but we could classify that as a mass shooting, certainly, as a domestic violence homicide, also as a firearm suicide. And I use that as an example of how inextricably linked all of these issues are. So again, I'm here to advocate for breaking down some of those silos and really looking at that violence as interrelated and on a continuum. And of course, many people have already referenced the shooting that happened in Mattapan earlier this week. And we know that that was a tragic incident that could have been more tragic. No lives were lost, but lives were forever changed because of that intersection of domestic violence and easy access to guns. And as we always say at the Coalition, someone might survive a shooting, but they live with that trauma for the rest of their lives. Thank you so much.
Thank you. Good afternoon, Chair Murphy, Council President Lujan, and honorable City Council members. My name again is Nithya Badrinath, and I'm the Policy Director at Jane Doe Inc., the Massachusetts Coalition Against Sexual Assault and Domestic Violence. JDI is a federally recognized coalition in Massachusetts with 60 member programs who provide direct services to survivors ranging from housing support, counseling and therapy, legal services and court advocacy, medical advocacy, culturally specific services, and so much more. 20 of our programs provide services explicitly to survivors in Boston, and because survivors may travel outside their community to seek services due to safety or accessibility, many more programs may serve survivors who are Boston residents. I'm grateful to the Boston City Council for this opportunity to provide public comment and for holding this hearing during Sexual Assault Awareness Month to recognize the need to improve the city's prevention efforts and response to sexual assault and domestic violence. We're incredibly supportive of Boston's new domestic violence, sexual assault, and gender-based violence prevention initiative, and enthusiastic about our partnership. As an organization that seeks to address the root causes of violence in our movement to end domestic and sexual violence, this program that centers all survivors, including immigrant survivors, trans survivors, and survivors who are criminalized, we appreciate this lens and hope for the city's investment in this program and other services for survivors. It's important that the city reinvest in and give power back to our communities. Such an investment means diverting resources away from systems that harm and instead investing in language access, housing, healthy food, public transportation, education, and so much more. It also means giving resources to programs who are working directly with survivors in Boston. We are living in a time where the rights of survivors are being threatened. The federal government is creating a climate of fear in rhetoric and policy and through threats to funding. 87% of sexual assault and domestic violence programs in Massachusetts receive federal funds. The state is currently working on their budget amidst a difficult budget year, and on the state level, we also have potential for cuts to our field. Despite the fear and in response to our present and the questions we have about our future, the reality is our work continues no matter what. Survivors are showing up and calling our programs every day. Our program, Sahaley and ATASC will probably attest to this as well. Advocates are accompanying survivors to court and helping them find shelter and housing, and programs are providing counseling and hosting support groups in multiple languages. JDI is also looking to pass legislation at the state level to support services. I will pass out a list of our priorities to you all, and the bills range from addressing survivor access to safety, economic justice, racial equity, human dignity, and education prevention. One in particular, which is H2466 and S1562, would create a state flexible cash program to make financial support available for survivors to access through community-based programs. Many of our programs already engage in this type of direct cash work to provide support to their clients when their needs range from rental assistance to support with childcare or transportation. Especially in a city like Boston, where the cost of living is incredibly high, programs that resort to limited unrestricted funds, that is to say, largely privately sourced funds to provide this support. We urge the City Council to support such an initiative at the state level and also look to the creation of a direct cash program for survivors and allocating unrestricted funds to programs to support survivors in this way. Preventing and responding to sexual assault and domestic violence requires us to invest in and support our communities to not just survive, but thrive. Once again, we are grateful for this opportunity to testify and are looking forward to the city's support of certain state initiatives and working with the city to continue this conversation. Thank you.
Thank you.
Good afternoon. Once again, my name is Dipali Gulati. I am the Interim Executive Director at Sahaley. Sahaley has been around for 28 years, providing cultural and language-specific support for immigrant women from South Asia and Arabic-speaking countries in Middle East and North Africa. We provide wraparound services in housing, legal, mental health. In a year, we are able to support about 300 plus women and their children with all these services. 80% of our clients are from South Asia, India, Pakistan, Sri Lanka, Afghanistan, Bangladesh, and 20% of our Arabic-speaking women from Middle East, Morocco, Egypt, and all the North African Arabic-speaking countries. About 7% of our clientele cannot read and write in their own language. Hence language barrier leading to, and financial barriers leading to financial barriers, immigration barriers are one of the basic needs of our survivors. We do not have enough cultural specific support in the courthouses, which leads to them not going to accessing the courts. Saheli is deep-rooted in the immigrant and marginalized communities through consistent presence and aligned services. When we talk about as a community-based organization, we understand the cultural relevance and the trust we have gained in the community. We understand the cultural, we understand the social barriers, the language barriers of our survivors. As a community-based organization, we are able to support, give them survivor-centric support and holistic support through our services. Prevention and education in the community and the colleges is from the cultural lenses, providing workshops in intersectionality and their cultural barriers. Advocacy support, change in policies, and how we can support the community, and working with JDI also helps us. But we are all working in silos. We are not working as a coordinated community providing a task. Us, we are all fragmented in providing similar kind of services. How can we come together with the city of Boston? I think one of the main ways we can do is providing cultural competency trainings to our professionals and community members, how to understand different cultures. We know the language, that there are different languages, but we are not culturally competent. We don't understand what the cultural humility aspects of our different cultures. Why does the woman stay back and not be able to access these services because of certain cultural barriers? We can come together to provide coordinated resource guide by including information of different culture and language specific services. Come together for joint outreach and community engagement and awareness events. Coordinate efforts for language access in the court systems, which is a big barrier for our survivors. So these are the barriers, and these are the ways we can come together. In the end, I would like to reiterate that we cannot work in silos. We need to come together to address the barriers, especially of our immigrant survivors. Thank you again.
Thank you.
Good afternoon, everyone. My name is Carline Desiree, and I'm the Executive Director of the Association of Haitian Women, known in Haitian Creole as Association Femmes Haïtiennes of Boston, AFAB. So we use the acronym AFAB. When you hear AFAB, it's the Association of Haitian Women. AFAB was founded with a simple but powerful mission to support and uplift Haitian women and families. One of our proudest accomplishments is the creation of CAFAM, a 6-unit affordable housing project and community center designed for low-income working families. From this space, we run a range of critical programs, including domestic violence services, adult education, youth empowerment, and grassroots organizing. But today, I want to do more than talk about our programs. I want to share a few real stories. Stories that speak to the pain, the strength, and the resilience of our community. Let's begin with Kathy. Kathy fled Chile with her partner, William, and their 4-year-old son, Harry, in search of safety and stability. They made it to Boston, but the relationship quickly turned dangerous. On September 29th, 2021, William returned home with a knife and tried to stab Kathy. Thankfully, someone intervened. Despite the trauma, Kathy allowed William to see Harry under supervised conditions, of course. But on January 16, 2022, after a weekend visit, William disappeared with their son. Kathy later found out he had fled to Canada. She immediately went to the police. Thanks to a court order and cross-border collaboration, Harry was found and safely returned to his mother at the New York-Canada border. Soon afterwards, after this incident, Kathy entered a new relationship. Her son, overwhelmed by change, began to act out. One day in frustration, Kathy spanked him with a belt. When the school noticed the marks, DCF intervened and Harry was removed from the home. Then, let's continue. Strong. Kathy had shown nothing but courage and commitment. She participated in AFAB's domestic violence and immigrant support groups. She attends courts with us. She enrolled in parenting classes and therapy. She never missed a weekly visit with her son. And today, she is on the verge of being reunited with her son. I'll share two short stories. Second one is John and Betsy. They were living in a shelter, struggling and fighting often. One day it turned violent. Betsy was arrested, and both were expelled from the shelter. It took over 2 weeks before they could even see their children. With the help of AFAB, they accessed visitation, support groups, and parenting classes. They're now back together as a family. And finally, Sandra's story. Sandra and her husband were accused of neglect. But what was the real issue? A translation error. Miscommunication during a DCF investigation almost tore the family apart. Thankfully, during a service trip organized by AFAB and the Task Force for Newly Arrived Immigrants, Marie-André Pierre-Victor, a mental health expert, was able to identify the problem and prevent unnecessary separation. These stories are not exceptions. They are reflections of the harsh realities of many Haitian immigrant families. Domestic and sexual violence is widespread, not just in Haiti, but here too, in our communities. Last year, we lost 2 young Haitian women due to domestic violence. One in Worcester on Valentine's Day, and another in Everett on December 6, 2024. These women were in their 20s, 30s. They were Black, they were Haitian, immigrant, they were traumatized, and they were failed by the systems meant to protect them. We cannot turn away from these truths. That is why your support matters. Your support for us to continue this work. Your support to prevent another child from being taken. Your support to stop another woman from being harmed, from being killed, from being murdered. Your support to break the cycle of trauma, violence, neglect. Today, I ask you to please continue to support domestic violence prevention work, not just in the Haitian community, but across every neighborhood in Boston. Thank you.
Thank you.
Good afternoon, Chair Murphy, Council President Louis-Jean, and Councillor Flynn. My name is Dawn Salma. I am the co-executive director of the Asian Task Force Against Domestic Violence, and also sit on the FJC Advisory Council. And I'm also a proud member of JDI. For over 30 years, we've served immigrant survivors of domestic violence, sexual assault, and human trafficking across the state, focusing on Asian victims with limited English proficiency. Boston is home to one of the largest LEP populations in the country. Nearly 1 in every 2 students in Boston public schools speaks a language other than English at home and has ties to 139 countries. While most visible in Boston, this reflects a broader statewide trend. Disaggregated data shows that across Asian ethnic groups in Massachusetts, 20% to nearly 60% of residents speak English less than very well. Many of these groups are classified as lower incident languages, meaning that they fall below the 5% threshold required for translated services. For Asian victims, this isn't just a barrier, it's a form of exclusion. Without information in their language, victims struggle to understand their legal rights, apply for benefits, or access health care. It deepens isolation and mistrust in institutions, making it harder for victims to seek help and rebuild lives. ATASK was designed to fulfill this gap. We provide trauma-informed, culturally specific care through case management, legal services, shelter, 24-hour hotline, all delivered in 22 Asian languages and Arabic by our bilingual and multilingual staff. Our advocates help survivors navigate systems that were never built for them, but we cannot do this alone. We are not usually with a victim at that pivotal moment, on a 911 call, in the hospital, or outside their home. That moment belongs to the first responder. What we need is collaboration. What victims need are hope. A referral can change everything. Information can change everything. Once that handoff happens, we provide in-language, trauma-informed care that connects victims to resources from housing to safety, services that most providers aren't equipped to deliver. Victims face control, fear, and isolation, but each group faces different barriers. Domestic violence and sexual assault victims are often silenced and disconnected due to language and immigration status. Human trafficking survivors are even harder to reach, moved around, controlled by others, and rarely referred to services. But all are more likely to seek help when they see translated materials and hear from someone who shares their language and culture. This is what real safety looks like, the kind that makes rebuilding begin. To strengthen Boston's response, we recommend expanding funding for culturally and linguistically specific services that serve as trusted resources and can build sustained relationships. Partner with community-based organizations to meet survivors where they're at, especially in those pivotal moments when first responders are face-to-face with somebody in crisis who doesn't speak their language. Establish real-time referral pathways between first responders and trusted providers like ATASK to ensure victims don't fall through the cracks. And collect and share disaggregated data on race, ethnicity, language, and service trends so that we're able to identify gaps and provide responsive care. Thank you. Thank you for your time and for ensuring that survivors are seen and supported.
Thank you. Thank you so much for all of your testimony. We'll go to questions now, Council President.
Thank you so much to this really all-star panel of advocates. I'm so glad that we have each and every one of you in the city, and for the incredible work that you do, often places from your own trauma, using that trauma to really propel the work. I heard a lot of similar themes, starting from Shakira and ending with, I want to make sure I get your name right, ending with Dawn, regarding cultural competency being important, and also the importance, and I think we kind of highlighted this, and I'm really glad that Director Mendoza-Arajeta is still here to really hear from this panel, but the importance of capturing, right, because for the most part, everyone here represents a community that has too often been sidelined or ignored or excluded because of the color of your skin, or because of the language that you speak, or how you show up in this world. And I think it's important that when we disaggregate the data, especially when it comes to immigrant communities, that we'll maybe be able to see some trends. I want to thank Nithya from the Jane Doe Institute. I think direct cash programs are really important, especially when you look at all the barriers that people face when it comes to leaving harmful and hurtful situations. It is like easy, like things that should be like, how will I pay for gas money, or how will I get, and having flexible, whether it's through philanthropy or through government dollars that allow for that flexibility to just help people. right, is incredibly important. And so many times you need to remind us of that as policymakers, because we put up so many barriers to people just being able to like get the help that they need. I wanted to talk about two factors that was discussed in the previous panel. And because I think the call to action is like, you know, Shakira, you stated it, Carlene, you stated it as well, everyone stated that you can't do this work alone. You need the support of the city. And again, I'm happy that we now have a director who's focused on that. We talk a lot about the ways in which folks interact when it comes to domestic violence, and a lot of it is the police. Two questions on sort of what would you like to see if there are improvements, and shout out, my sister was an ADA an assistant district attorney for 4 years, worked in tandem with so many of the DAs, victim witness advocates, and we have them here in BPD, wondering sort of like what are the things that we can support as from the city level when it comes to our victim witness advocates, the improvement that you'd like to see, because I often know that people are falling through the cracks, and you probably see that as well. So what are the things that we can do on our end to help sort of prevent those cracks from happening? So that would also, I think, take some work off of your plate as well, the fewer cracks that we see. And then the second question is, one of the biggest cracks that we see, and I've been talking to a bunch of folks and that from experience, is housing. So recommendations and suggestions to us on housing. And then lastly, there's this bigger issue of root causes, and I think Ruth, you did talking about, accessibility of guns, and we are one of the, a lot because of the work of your organization and advocacy, we're one of the safest states when it comes to gun access and gun laws. But what more, is there more that we can be doing? And I think that goes to the fundamental question of both accessibility but education around domestic violence and how we destigmatize it. So the two main questions are around how we improve our victim witness advocate programs to make your lives easier, and the second is around housing, but I know I said a few other things, so feel free to be responsive to any of it.
I don't mind jumping right in. In reference to how we improve victim witness advocate support from the city and with organizations represented here today. First, I would start with looking at organizations or nonprofits who receive direct funding from the city, making it a requirement that they support sister services, and also too that they're in the field outside of their sector. One of the issues that we see is that some nonprofit organizations have said that they do not have experience outside of their work focus, and so having the requirement for them to support the victim witness advocates in reference to making sure they're a listed and readily available resource would help to mitigate some of the risk in terms of wraparound services or first responses. Another way that I think that we could address the issue with VWAs and nonprofit organizations, and specifically to Shakira's story, is working as a collective as opposed to working in silo like we heard before, in reference to identifying the need to fill these gaps and knowing that there are loopholes in the system, and they were there before we got here, right? Before this issue became as big as it is. And recognizing that when we work together as a collective, we can now start to fill those buckets, if you will, where families are being lost through these loopholes. And the point that I'm making is the victim witness advocates work at the DA's office, who are the first responders to these issues when individuals seek legal support. And so when they work in tandem with organizations such as the ones that are represented here today, we can start to really pan out what this safety plan looks like, because the reality of it is both systems are looking at this need for individuality in terms of what specific services these individuals require. And so if we have a broader perspective on what these issues look like, and also to a broader understanding of the fact that some of our organizations have a more in-depth relationship with community-based organizations that are on the ground doing the work, as opposed to some of these more formal legal aspects, and mostly going back to the issue of mistrust between survivors and victims of domestic and sexual abuse.
Can I add?
Yeah, sure.
As an organization that serves a limited English-speaking population, a lot of our advocates work directly with the district attorneys because there is, I mean, the language is the barrier, and that's the absolute key. And oftentimes, the victim doesn't want to work with anybody else once they have the advocate in place. That is their central case
The advocate
manager.
in place that speaks their language? Or
Yes,
just,
the advocate in place that
exactly.
speaks their language. And so there's really no way around that. That is the best practice right there. If there were to be other solutions, I mean, one thought is to like think about what district that you're in. Say Boston has a lot of, depending on where you are, Vietnamese or Chinese, maybe that is the language that they're going to have for the next victim witness advocate that's hired. And I don't know what what languages that they have, either at BPD or in other locations, but that's something that I would be thinking about.
Thank you.
I would second what Dawn said. Language is a big issue in the court system as well. We have survivors who don't want to go to the court without our domestic violence advocate because they don't trust the court system and they cannot communicate. They don't know the legal language. They don't understand what is going on. So having somebody who understands the language and the culture, I emphasize on the cultural competency training of the court system. I have seen judges who are not culturally competent, they don't understand what the survivors have gone through, being an immigrant here, having left their families, being alone here. So I would highly emphasize on cultural competency trainings.
And is that both from your experience, is that both coming from the Boston Police Department and from the district attorney, the victims witness advocates, or is it predominantly from the district attorney's office?
I would say predominantly district attorney's office.
Mm-hmm. Thank you. And just when I spoke to the district attorney about this yesterday, was speaking today on the phone with the chief of the victims witness advocates from the DA's office, and this is feedback that I will definitely take back to them. So just thank you for elevating.
If I can add to that, I don't think it's on now. If I can add to that, what was said about victim witness advocates working with domestic abuse advocates, we've seen that when victims of abuse or survivors of abuse go to municipal courts to file for a form of 209A, there are signs that are outside of that office that says we do not assist with filling out this form. And so if we could have victim witness advocates be informed of different agencies that they can contact to say, hey, we have a victim here who is seeking a 209A, and we cannot unfortunately help them to fill out this form, if someone from your office can be a representative, or maybe it can be something where it's a readily available system. I know Dove is readily available in the court systems in Quincy. And so if the Boston area can continue to think about how do we adopt that idea and bring it here, I think that will be one way that we can help to mitigate risk. Because to your point, when victims get in front of a judge, when there's a language barrier, sometimes they can't convey anything other than he hit. And so in order to obtain a 209A, there needs to be some substantive information that goes with that. And so to help survivors to really get what they need in that moment, I think would be critical. The other piece is knowing that there are interpreters in the court system. Another issue that we're seeing in terms of interpreters in the court system is that they're not always readily available. I know we do have this electronic system that is being used in some court systems that will provide translation, but that is not always the case depending on the language. And so to the point that was made earlier today, the language barrier is a huge issue across all sectors.
I second that opinion. I think we definitely need culturally and linguistically appropriate services in law enforcement at the community level. But I wanted to share relation building is really critical. And I'll share an example. We've been around since 1988. In 1998, we decided that this is DV, domestic violence and sexual assault, is such a massive problem in our society that it was imperative that we work in partnership with different organizations. So we started this roundtable on domestic violence and sexual assault. It went very well, even up to today. Pre-pandemic, it was just amazing. We had representatives from the district attorney's office, we had DCF, we had DTA that's still around. We had different shelters. We had about 25, the police force, Area B3, I'm talking about Boston Police Department, and Brockton Police Department, because 30% of a good number of folks come from Brockton as well to our office in Boston. So we're talking about, for Boston alone, we had representative from B3, C11, and I want to say E12, I think, Hyde Park office. I think, yeah. In any case, what happened with this round table setting was cross-culture training. It's about what's happening in our community and also doing presentation to inform one another in terms of how to best approach the work. And very often we would do, if you will, case study. Of course, not mentioning names. It doesn't have to be that way, but what I saw happening is relationship building with the police force, with the court system. We were involved with the Family Justice Center in the beginning. I would meet with the judges at the Dorchester District Court, and it was again about learning different aspects of services, culture services, linguistically appropriate services, understanding the culture. So how do we bring that back? We find that a lot of, like you mentioned, with interpreting services, we had so many different cases that were postponed in court in the last 2 weeks because they didn't have translators. Before, they allowed advocates to step in, but that's not the case anymore. So we really do need, and Dorchester Courthouse, with the work of so many organizations and the Department of Public Health, it was like a model in terms of they had the most different language capacities. And now I don't know what's happening, but we need to bring it back. So what I want to close with is we have to find ways to put in the budget so these experts, whether it be at the police force, at different agencies, can really have the time to connect with different organizations, people doing the field work in Mattapan, Dorchester, Hyde Park, East Boston. How do we make that happen? How do we make it mandatory so we can better address the situation, the heavy load of domestic violence and sexual assault in our communities?
Thank you.
I just want to echo everything that was said here, especially around language access and collaboration with agencies, especially programs. And the other, comment on, everyone said it already, with what it means when a survivor's case is being postponed because an interpreter is not available. What that means for lost wages at work or childcare access. There are so many domino factors for when your case gets postponed and everything you need to navigate in that case. So I think the bottom line is just resources, especially programs. Are really, we're really living in a climate of fear right now, and what that means for our programs and their access to federal and state funding at this very moment, and any sort of resources that the city has to support every program who is doing the work on the ground, and really making sure that the city develops relationships with, we said 20 of our programs provide direct services in the city of Boston, really making sure that the council develops relationships with every single program to see, I think if you were to talk to a housing advocate directly and just hearing, all the things that they're experiencing, navigating what it means to navigate such a complex system. I think, what we're seeing at the state level, especially, in Boston with the huge housing crisis across the state, especially in this city, and what that means for both shelter and also access for permanent and stable housing. When shelters are overwhelmed, it makes it really difficult for folks to be, moved out of, shelter and into transitional housing and into permanent housing. And, our systems are overwhelmed, and it creates a bottleneck effect for what it means to get folks into stable housing. So, we really need to consider every, especially in the housing realm, every single part of the housing process needs attention, needs resources. And our programs are seeing, the impacts of especially state regulations on shelter right now, and what that looks like. So, I think my just simple answer is we need funding, we need money and support for all of our programs here in Boston.
Working. Oh, thank you. In terms of what we would like to see happen, a couple of things I wanted to touch on. And I think Boston is a place where we can really engage in some innovative practices. Historically, we've talked about domestic violence and gun violence prevention in two totally separate buckets. And I think this is a place where we can start to break down some of those silos. When we think about, spend a lot of time working with young people talking about healthy relationships and nonviolent conflict resolution, we tend to think about that as domestic and sexual violence prevention, but that is also gun violence prevention. And the way, when we change our language, when we change the context for how we talk about this work, we also change the culture around that. I think a lot about when we have violence that happens in the community, really examining what triggered, and it's probably a poor word to use, but what really brought on that violence, how much of that is related to dating relationships, romantic relationships, where the conflict spills over into the community, because we know that violence doesn't just happen in someone's home. It happens in schools and in the community. And we're not going to know that unless we ask those questions. And to see violence really on a continuum where we're not dividing what fits into the domestic violence realm in one place and what fits into the gun violence realm in another place, which is why I'm so excited about some of the work that is happening here in the city. And to build on what Nithya just said too, we have to keep on naming the threats happening from the lack of the disruption of funding from the federal government. In the gun violence world, we just saw a major disruption to community violence intervention funding, which will impact the work here in Boston. It will impact the work here in Massachusetts. And while we know that Massachusetts has lower rates of gun violence than any other state in the country, that one shooting is too many, and we cannot go back. And so any way that the city can show up for this work in light of the disruptions of funding that's happening from the federal level, that is never been more important. What we do in every state matters greatly, and what we do in every municipality matters greatly.
Thank you.
I'm going to let my colleagues ask questions, but what I'm hearing, and again, happy that both of our directors are here, because I think that there's a role for women's advancement, there's a role for the initiative, and for others to bring in other departments to, we shouldn't be working in silos, both in sort of organizationally, because it's terrible when there are gaps that exist that people could, there could be a lot more cohesion, right? Especially where there's overlap, that this is your jurisdiction, this is our jurisdiction, and this is how we're working together. So I'd love the city to take more of a leadership role in filling that silo, but also I think, Ruth, your point about silos, both in the substance, right, of how we're talking about issues, is incredibly important. And I also think that there's a role for us, and I think that's part of the work that the city is attempting to do. So I thank you for elevating and highlighting that. I'll allow my colleague, I'm going to turn it over to my colleagues and ask questions.
Thank you. Councilor Flynn.
Thank you, Madam Chair, and thank you to the panel for the important work that you're doing, and was listening closely to everyone in your comments, and you're doing exceptional work across Greater Boston, across the Commonwealth, really. My question, and I'll open it up to anyone that wants to answer it, but my question would be, domestic violence, when children are impacted, a little boy or a little girl, but just say a little boy, he sees his mother, a victim or survivor. He sees his mother being assaulted repeatedly, or emotionally assaulted repeatedly by her partner, his father maybe. But what impact does that have on that boy growing up? What type of services would that child need? What type of mental health care, counseling would that child need? Because he's also, or a young girl, but they're also dealing with ongoing trauma as well. Is that something that you have focused on?
thank you, Councilor Friend, for bringing that up. To your point, the child who witnesses abuse is the secondary victim in this case, and that's often something that we don't hear a lot of, unless, and of course, there are systems in place that know about this child being a victim themselves. That child has experienced psychological trauma, and there are many, many more incidences of trauma or types of trauma that will stem from just that one incident. I believe studies show that children who witness abuse or even acts of violence where there's a homicide, I believe the numbers are between 80 and 90% that a child is the primary witness. And so you raise a valid point. There's going to be a long-term need of support services because statistics and data also show that that child could potentially become a perpetrator of abuse themselves, if not be one who's involved in a relationship that it has intimate partner violence. And so there's so many different ways. I think it's circumstantial. For example, if this child is taken into DCF custody, which we heard earlier, a similar case where the child was taken into DCF custody, we've seen cases where this was the case, where the child witnessed abuse, and DCF had to remove the child for safety reasons. The child is now in DCF custody. The child now experiences sexual trauma in DCF custody, and that's a common theme that we've seen, or trend that we seem to see happening across many different groups, and that's irregardless to sex, race, or educational background. We do know that in reference to domestic violence, there's a large population of Black and brown women and girls who experience it, but we also know that Black and brown men and boys are also victims of abuse, and so I want to thank you for bringing this question. I also want to state that the primary victim and the secondary victim are facing trauma simultaneously, but the secondary victim, oftentimes we don't see the effects of those traumas until years later, and sometimes depending on those social determinants of health that child is facing, whether it's poverty, low education, or any of those other issues, we might look at it as it's something to do with that as opposed to the root cause that was brought up earlier by Madam Counselor. And so your point is very valid. I also love that you raised the point that this could be a young girl who is witnessing or a young boy. And I also too want to close with, there's this distinct difference between outcomes, right? For a girl, she's more likely to find herself in the sexual abuse to prison pipeline, which the Georgetown University did a study that showed that Black and brown women and girls are likely to travel this pipeline. For the boy who has experienced witnessing abuse, he is likely to travel the school to prison pipeline. If in fact there aren't any wraparound services or immediate responses to making sure that we identify what those root causes are and what this can, what the trajectory of that child's life could be. And so services such as ours would be very impactful on a city level in the sense of when we have those 911 calls that come in, like this family that just happened in Mattapan, we know that that 4-year-old child is going to have a lifetime of trauma. And so enlisting organizations such as us to support now and in the long term will be beneficial to not just that child, but to the family now and moving forward.
I'd like to add a few words with us at the Association of Haitian Women. Can you hear me?
Yeah.
Now you can hear me. With us at the Association of Haitian Women, we are aware of this major danger with the children who are witness to domestic violence, and we were in the early days, we used to do work with the kids on Saturday. It focused on violence prevention and different types of cultural activities. The connection with culture, there's also, we used to be part of the family justice team, and we stopped at one time. One of the things we found that was hard, could have changed over the years, just like Gender Inc., you know. In the beginning, we had discrimination with our people at the shelters, and we brought it up, and we had an article that came out on the Globe, and we saw a lot of changes over the year with Gender Inc., and we are submitting our application soon. Now, with the children piece, you have the group with family justice with, I'm referring to child witness to domestic violence. I forgot the exact name. The cultural piece was missing. You know, and it's again, you know, a quarter of the residents in the city of Boston, they are immigrant or descendants of immigrants. That's even put the number even higher. So we have to look at all the different challenges we face, including the secondary trauma for the children who witness what exactly domestic violence or sexual assault. what exactly does that mean in terms of services? It could be simply pure English. It may be in Spanish. It may be in Vietnamese. It may be in Haitian Creole. I know it's a lot we have to consider, but how do we factor that in as well? And also the advocates who do the work, there's the secondary trauma too, and they need to be taken care of. And very often, the small nonprofit organizations don't have the finances necessary to address this. We need to address it. It's not just the child, it's also the women that, they put in the work day in, day out. They also need to be, their trauma needs to be addressed as well.
Add something. To Carlene's point, one thing that's severely lacking are bilingual therapists. We all work with victims of trauma. We cannot find them therapists. And so exactly what Carlene's saying is our advocates are acting as pseudo-therapists, and there's no other options. And so, one, yes, they need their own support, but then two, we really need to create that pipeline. There are a lot of community groups right now that are talking about how do we create this pipeline starting with schools, and how do we encourage bilingual therapists or the work of bilingual therapists and social workers, because they're so incredibly needed. And a lot of the times, even if you want to have family therapy, you might have that child who speaks English, but their parent speaks another language, and they cannot work on whatever issues they need to together. And so that's one of the things that if we were to look for funding, that's another really important area that often gets overlooked, particularly when thinking about those that speak limited or no English.
I totally agree with Dawn that we also struggle with getting bilingual therapists. We used to have one at work. So, can you hear me?
Yep.
We used to have one at our Sahaley office, but again, organizations like us, we lose funding and we lose the service for our survivors. But one thing I do believe is prevention is better than cure. So going into schools and colleges, talking about healthy relationship, building up curriculums around domestic violence and sexual violence, and teaching young boys and girls at a very young age what are the red flags in a relationship and how they can prevent. Sometimes they don't know. In a culturally specific home, they don't know. We are so desensitized to domestic violence. Moms don't know that this is abuse. Children also don't know if they are brought up in that environment. So they need to learn from their school or from their counselors what is a healthy relationship, what are red flags in a relationship, and built in a curriculum. We work out of Woburn town, and I went back to the Woburn High School and said, I want to do some healthy relationship. They said, no, you have to go to the city council and the board to build in the curriculum. So we as organizations cannot go build the curriculum unless it comes within them. So that could be a different way also. Like I said, prevention is better than cure.
Thank you. Thank you all for that, for the informative information you provided. I know it was mentioned earlier, I also want to acknowledge Kimberly and Reverend Scott for still being here and listening to this conversation. Thank you. Exceptional city employees. Madam Chair, may I ask a question to you?
Yes.
Madam Chair, I know we can't get this information now, but can we put it on the record? Maybe we get it sometime next week. But are we able to find out what BPS, Boston Public School System, is doing to support students in the public schools if their parent is involved, is a survivor of sexual assault or domestic violence? Can we see what type of services that student is being offered? And maybe there's an opportunity for us to advocate for some of those programs.
Yes, definitely. And I know, Ruth, you brought up how it's the whole family, and I know many of you have spoken about the children, so that was actually a couple of my questions, definitely. So we'll make sure we get some answers there. Thank you for that.
Thank you, Madam Chair. And again, I want to say thank you to all of the advocates and the community partners that are here, and just wanted to say thank you for the incredible work that you are doing. Maybe I'm most familiar with the Asian Task Force Against Domestic Violence. I know the exceptional work they play across Massachusetts, but I know all of you also do exceptional work. So I want to say thank you, and thank you, Madam Chair.
Thank you. There are 4 panelists or people who have already signed up on Zoom that we're going to go to, but please stay because we're going to ask some more questions. So we'll go first to Charles Horenstein. And we also have people who are here in the chamber who have signed up, and we will call on you soon also.
Hi, everyone. Are you able to hear me?
Yes, thank you.
Yes, thank you so much for the time. I really appreciate it. And thank you so much for having this public hearing today. I'll try to keep things as close to the time as possible. So my name is Charles Hornstein. I represent the organization Harbor Cove, which is a domestic violence service agency that works with survivors in the Chelsea, Everett, Malden, Revere areas, but also serves the greater Boston area. So first off, regarding the comments for data-informed decisions and earlier statements, I really encourage those that collect data at every level to ask several questions before drawing conclusions. So I'm the database manager at my organization, and the biggest thing I always try to encourage people to understand is that a decrease in reporting doesn't necessarily mean a decrease in domestic violence. For example, like during the pandemic, we had many providers, including Harbor Cove, see a decrease in reports, but that was because of lockdown limited both moments that a survivor could make a call and be alone, or moments that family and friends would cease behavior and, maybe say something about how problematic it was. So just definitely keep in mind looking for a more holistic approach rather than jumping to conclusions. Regarding the City Council President's calls for what we can do to be proactive rather than reactive, I support a lot of what JDI's panel said. But my biggest personal recommendation, in addition to what they said, is to make sure that we have as many housing options as possible. In particular, I really want to amplify the MRVP bill H1547 going on to the State House, because in both my time serving clients and directly supervising those that do, I've been finding that housing plays a really critical role in making sure that people have options rather than ultimatums. For example, if an abuser is trying to find them, that limits where they can work and where they can rent apartments, and sometimes public housing isn't really an option because there's too close to vulnerable areas as for the options that they have, whereas mobile vouchers not only ensure more areas are affordable, but it also makes sure the survivor has flexibility to move when emergencies come up. I also want to encourage the Boston Police Department to make efforts to promote officers that are particularly people of color, women, people in the LGBTQIA community, and immigrants in particular, as this both plays a role in people feeling more comfortable reporting and also ensures that there are fewer niche reasons that DV that can fall through the cracks unnoticed. To give you an example, immigrant survivors not only face domestic violence in the forms of physical abuse, but they also face abuse in forms of things like threatening to destroy immigration documents, threatening to report people to ICE, separation from children, lying to survivors about their rights, things like that. And for every one of these groups, being able to engage with people with lived experience can go a long way to make sure things aren't unnoticed. Last but not least, I really want to encourage the City of Boston to fund not just DV efforts in particular, but also, or in their own city, but also in the surrounding areas. So Harbor Cove, for example, depending on the year, will serve between 5% to 20% of our client base as Boston's residents, because they're either coming from Boston fleeing violence, or they might move to Boston to escape their abusers here. So many survivors don't end where they start in terms of the catchment areas. So demographic data at intakes can be very misleading and confusing. But there's also a lot where surrounding neighborhoods are providing relief to domestic violence in Boston, but are not receiving funding accordingly. This is especially concerning because DV cuts are being faced at the federal level, for example, with the current presidential administration changing the legal definition of domestic violence into the Violence Against Women's Act means that fewer people qualify for services and fewer organizations qualify for funding, as well as the Victims of Crime Act, which funnels money into the OVC through legal fees at the corporate level has been impacted due to corporate law accountability changes that make it harder to prosecute abusive corporations and in short, leaves less money for the OVC. And this is before we even get into, of course, the more commonly known parts where organizations are in threat of losing funding due to efforts to be inclusive to all different marginalized statuses. So overall, I think that it's very important just to keep this as much on our radar as possible, because one thing that a lot of providers will say is that DV services are commonly put in what we call second most important syndrome, which means that, you know, all of our legislators will tell us that DV is a priority, but then that doesn't necessarily reflect in the policy changes and the funding changes. And I want to be clear that I think it's very understandable. There's a lot of competing priority considerations, and there's a lot of urgent matters. So this is a normal part of the process. But I think when it comes to domestic violence, the big thing to remember is that there's going to be a lot of people who are fearing their life and fleeing violence that they may not live to see the time that our government runs its course and does our best to make sure our intentions match our impact. All that said, so I just want to wrap up saying the three big things I want to focus on: strengthening MRVP programs and mobile housing voucher programs within the city, expanding the legal definition of domestic violence to include not just physical violence, but also things like immigration-related intimidation, financial manipulation, financial threats, other forms of coercion and control that create power balances, and last but not least, expanding funding considerations to not just providers in Boston, but providers that serve Boston. I want to draw a lot of attention to the police officer that said that his definition of domestic violence is solely the law. And while I understand that, you know, someone who's assigned to protect and serve under the law would need to say it that way, I really want to emphasize that we are people that we're surviving are limited by what the law allows us. So we need to make sure that the law accounts for as many different possible outcomes as possible. At any rate, thank you so much for allowing our organizations a chance to speak today, and we look forward to working together for positive changes in the future. Thank you so much.
Thank you, Charles. Next, we have Juliana.
Oh, I'm sorry. Juliana actually had to go. She ran out of time, so Harvico was all set.
Thank you. Thank you for being here. Next, we have Lauren Gordon.
Can you hear me?
Yes, we can.
Thank you. So thank you all for hosting this initiative today, Councilor Rucci, for providing a space for this topic of conversation. So my name is Laverne Gordon. I'm the founder and president of an organization called Love Life Now Foundation, which promotes year-round awareness around the issue of domestic violence. And while we are focused on prevention and awareness, we do have a direct service. So I'm coming from both ends to that point, as well as from a survivor standpoint. So a couple of things in terms, first of all, thank you to everyone that presented today. Everyone did a phenomenal job in sort of naming the things that are sort of rooted in where the gaps are, and that's primarily what I want to start out with. I said, so we can speak, Love Life Now can speak to the financial assistance for those actively fleeing. We receive 5 to 7 applications a day from DV advocates across the state from various avenues: hospitals, DTA, police stations, and DV agencies for direct aid from what we call our Get Safe Fund, where the top help is for emergency hotel stays. As Kimberly mentioned earlier, DV shelters are almost often full. And the next top aid that is requested is essential needs, so food, clothes, toiletries, etc. Another thing that I wanted to touch base on is folks have named that there should be more community partnerships with community-based organizations. Yes, offering trainings for these groups on how to recognize abuse and refer to trauma-informed services who closely worked with trusted cultural, faith-based, and immigrant organizations. Survivors often turn to who they trust. Simple, organizations, I don't want to name what they're doing as simple, but hair salons. Folks are often disclosing what's happening to them, to their hairdresser. So getting into these spaces where churches, where folks are disclosing what's happening to them to be able to try and mitigate prevention. More awareness workshops around DV and healthy relationships for teens. I know that was also named by various folks. I think any of the groups that spoke today can attest to the value add that this brings around prevention. After presentations that we put on, kids and young adults at high schools and colleges often state that they themselves are experiencing abuse, their mom is going through it, or a friend is going through it and they don't know how to help. And so providing that resource for them is so value add. Community trainings to empower more upstanders, like the ones who heard what was happening in Alston this week. I know we talked about the Mattapan case, but the Alston case earlier this week, where one male witness mentioned in part that he saw things being thrown out the victim's window, but he thought it was a couple's fight because that happens here a lot, end quote. These are the folks, community, neighbors, passers-by. These are the ones that we need to reach as well, who hear the ruckus happening, but they don't feel it's their responsibility to do something because the victims keep going back and they like it, right? Or they think that they will get in trouble because if they with the abuser, if they happen to call. So, these are some of the suggestions that I wanted to bring here today, and I just again appreciate all of you for the work that each of you are doing. Thank you.
Thank you. I'm going to go to public testimony. If you're here, I hope you're all still here. First, we have Nia Wilson or Naya Wilson. Are you still here? Oh, good. Okay. You can come right here to this microphone with the laptop in front of it. And if you could just state your name, your organization, and everyone has 2 minutes or more to speak.
Sure. Oh, good afternoon. Well, it's not afternoon, it's evening now. But my name is Naya Wilson, Dr. Wilson, and I work for Justice for Housing. I am what they call the Hands-on Defense Program Manager. And I'm also a survivor of both community violence and domestic violence, so I have lived experience. And today I'm just humbly speaking on behalf of Leslie Creedle. She's our founder and executive director. And she wasn't able to be here because actually she's filming a documentary for Lifetime about the work of Justice for Housing. So that's going to be interesting to see. As part of our mission, we're committed to ending housing discrimination and homelessness for individuals impacted by incarceration and those criminalized for being victims of domestic violence. They have survived and are punished. So as you all know, according to the CDC, domestic violence will affect 1 in 3 women at some point in their lifetime, and 1 in 4 experience severe physical violence. 44% of lesbian women experience violence as an intimate partner in their lifetime, and 1 in 4 gay men, and 1 in 3 bisexual men experience intimate partner violence. So this year we began at Justice for Housing to focus on the work of supporting women and men who are victims of domestic violence. And in just 10 short months, we provided permanent housing for over 32 men and women. Right now, as we speak, we have 2 women who had to flee with their children in the middle of the night and placed in hotels in Boston, as many people spoke about. One woman, after spending 6 weeks in a hotel with her 3 children, we finally are putting her in a 4-bedroom apartment tomorrow. So we're really excited about that. The issue is that we spent over $12,000 in hotel costs and $900 to pay a driver to take her children to and from school because she was fearful that the abuser would be waiting there at the school for her. Tomorrow, we'll be spending $17,500 on first, last, and security, broker fee, and furniture for her. Our DV case manager will provide stabilization services by doing weekly house checks until they both feel safe, develop safety plans, provide mental health services, employment search, financial education, and anything else, and anything that she'll need in order to stabilize her, and that's the work of what DV support looks like. So we'd love to continue this work. We have found the intersection of people who are formerly incarcerated and people who have experienced DV, that it's prevalent. We do need financial support, so we're requesting the $250,000 in ARPA funding to provide emergency housing and rental assistance in order to protect our most vulnerable citizens of Boston. We also have, right after me is Jada Goforth. She's been waiting patiently to be able to speak, so please welcome her, and thank you for your opportunity to speak. And I just want to say that the panelists, this was an incredible time for me. It was, it was heartfelt because of what I had been through in my life, and so I really want to thank everyone for the great work that they're doing.
Thank you. Jada, you are next. Thank you.
Right here, right?
Yes. Thank you.
Okay. Good evening. My name is Jada Goforth. Well, I'm sorry. Let me start over. Good evening, City Council, community members, and guests. My name is Jada Goforth. I am a mother. I am a survivor. And today I stand before you just for myself, but for thousands of women, families across the city who are trying to survive what I've already been through. 5 years ago, I was pregnant with my daughter when the first person I trusted most, her father, turned violent. What started with shouting turned into shoving and into beatings that no woman, no human being should ever have to endure, especially not while carrying life inside of them. I wish I could tell you that I got out right away, but I didn't. Like so many women, I stayed out of fear, out of hope that he would change, and because I had nowhere else to go. When I finally found the strength to leave, I was already broken physically, emotionally, and financially. What followed wasn't safety, it was homelessness. I was sleeping on friends' couches, often in my car. I had a newborn in my arms and no keys to call my own. I was in survival mode every single day, not just for me, but for my baby girl. My baby girl's name is Raylan. She's 5 now. She loves to sing, she loves playing video games, and she could talk your ear off all day. Thanks to Justice for Housing, for the first time in her life, my daughter actually has a place to call home, and I appreciate that. Housing gave me more than shelter. It gave me the space to breathe, to heal, and begin rebuilding a life that was torn apart for me and my baby girl. And it also gave us a future to look forward to. Domestic violence is not just a private issue, it's a public crisis, and it's a housing crisis. We don't need pity, we need policy, we need investment. I'm living proof of what's possible when we invest in our survivors. My life is still hard, but I'm standing and I'm stronger. And more than that, I'm fighting every day. Not for just me and my daughter, but for every woman out there. And is still wondering if anybody cares, please show them that you do. Thank you.
Thank you, Jada. Sheila Gobar? Thank you.
All right. Good evening, esteemed counselors. Thank you for this opportunity to testify today. My name is Sheila Gobar. I serve as the Support to End Exploitation Now Program Manager at the Children's Advocacy Center of Suffolk County. It is my privilege to speak on behalf of the CAC about the needs and services that are vital to one of Boston's most vulnerable populations impacted by sexual assault and domestic violence, a group often unintentionally left out of conversations about these pervasive harms, children. Talking about child sexual abuse is difficult. It is common for communities to want to believe that this type of violence is rare. I think we all know that that's not the case. Stigma, shame, and fear can make child abuse hard to discuss and even harder for children to disclose. Research shows that 1 in 4 girls and 1 in 13 boys will experience sexual abuse before they reach their 18th birthday. Marginalized communities and people living in poverty face heightened risk. And without the right support, the impact of abuse on child well-being, mental health, and psychological safety can be devastating. This is why the Children's Advocacy Center exists. Since 1995, the CAC has led the response to child sexual abuse, serious physical abuse, and commercial sexual exploitation of children here in Boston and in Suffolk County. Together with our tireless partners, the CAC strives to ensure safety, healing, and justice for young victims and their families. The heartbeat of the CAC's work is collaboration. We coordinate with over 25 public, private, and community organizations, including instrumental partners at the Boston Police Department, their incredible family justice units, you got to meet some of them earlier, the Suffolk County DA's office, Boston Public Schools, the Massachusetts Department of Children and Families, health centers, community-based centers, hospitals, libraries, and more, to leverage resources and to provide comprehensive care. At our site, we specialize in multidisciplinary coordination, victim-centered forensic interviews, multilingual case management, expert medical services through the SANE program, and on-site evidence-based bilingual trauma counseling. The result? A prompt, culturally competent, and coordinated intervention for youth and families in crisis, all under one roof. Last year, the CAC received 1,655 referrals for children in need of our free trauma-informed services. And while this number is staggering, we know that this is only scratching the surface here in Boston when it comes to identifying child abuse victims. Last year, our CAC delivered 114 custom trainings to more than 4,000 participants to raise awareness, prevent abuse and exploitation, and also to strengthen our community in its ability to identify and respond to child victims. And while we're motivated by this progress, we know that more work needs to be done to reduce the stigma and to ensure that our Boston families know where to go to seek help and support. It's an honor for us to help families, and we are so grateful for this opportunity to raise awareness and to highlight the critical needs for children here in Boston. Thank you all for shining a light on this issue today and for your continued advocacy and support for Boston's most vulnerable members. Thank you.
Thank you so much. Savannah
Oh, she had to
Willis?
leave.
Okay.
But can I read her testimony into the record?
Yeah, sure.
Okay.
Savara, if you're listening, I'm sorry that we couldn't get to you. I know she had to go to a children's party, but I mean, and also this is a phenomenal panel, and there are so many more people who could have been on this panel who are doing this work. So the good doctor shouted y'all out, so just want to do that again. But Savara is a person who could have definitely been a panelist. She says, "Good afternoon. My name is Savara Willis. I'm a resident of Dorchester, and I work at Brookview House as the Community-Based Services Manager. For the past 2 years, I've worked with survivors of domestic violence, helping them find the safety and support they need to rebuild their lives. Domestic violence and sexual assault are personal to me because I survived both. These aren't just topics I talk about. They are part of my story. I know the fear, the silence, and the pain. But I also know the strength it takes to survive, to heal, and to reclaim your voice. That's why I advocate, because no one should feel alone in their struggle. And if sharing my truth helps even one person feel seen, heard, or empowered, then it's worth it. As a survivor myself, I understand the way DV has the power to impact every area of your life, not just physically, but emotionally, psychologically, socially, and economically. And those impacts are not only limited to the person experiencing the abuse. Children are often the invisible or unseen victims of violence in the home. What they observe and absorb is traumatizing, and it can affect a child's ability to learn, their behavior at school, their ability to socialize with peers, and more. When evaluating the efficacy and the scope of services for survivors of domestic violence, these youngest unseen victims must also be considered. At Brookview, we focus on breaking the intergenerational cycle of poverty and housing loss, and we do that by taking the whole family system into account, tailoring our services to meet the needs of each individual from a trauma-informed lens. We also offer crisis intervention, danger assessment, safety planning, and emotional support to those facing domestic violence in the community. Last year, more than 200 individuals accessed our DV support services. It's worth noting that the vast majority of families presenting for emergency shelter programs have been impacted by domestic violence in some way. For many, it is the reason why they are there at all. Escaping an abuser often goes hand in hand with creating financial and housing insecurity for oneself and one's children. It requires great courage to face such risk. We know we can help survivors and find resilience and inner strength when we center their needs, and one thing every survivor with children absolutely needs, like any parent, is for their kids to be safe, healthy, and well-resourced so they may all heal. Thank you.
Thank you. Delia?
Hello. Hi, my name is Delia Vega, and I am a senior survivor mentor and policy specialist with My Life, My Choice. And for those who don't know who My Life, My Choice is it's an organization that works with young people who have been sexually exploited. And again, I mentioned I'm not only a survivor, but I'm also a mentor. And, you know, I just want to add, like, the youngest person that I've worked with as a mentor is 12 years old. And so there's a lot that I want to say, but a lot has already been sort of put out there. But I want to touch on a couple of things. And so, you know, immigration, the lack of language supports, language barrier supports is one. But I also want to add for folks like attorneys, I think that, and particularly with parents who, you know, family attorneys, because part of what I've seen, so again, I'm a survivor of all the gender-based violence that has been mentioned here today, of trafficking, of domestic violence, and sexual assault. So I think, and as a parent, one of the things that I also had issues with when I was trying to rebuild my life is not having access to attorneys. I mean, someone here mentioned that you go to the courthouse and you kind of have to navigate that system on your own with the paperwork. I'm like, I don't know what this means. And so, like, I have to bring it back. And, you know, and I am also a policy specialist. So I've navigated system for a really long time. And still, it's difficult and challenging for me. So I can only imagine with parents. So having attorneys readily available. And the other thing I want to make sure that is mentioned or added as we're creating, or you all are creating policies, that people are involved in every step of the way of the creation, not only the creation, but also the regulations piece and the implementation. Because what starts out as something really well-intended, but aren't including, right? So folks with lived experience are included in the creation piece, but we're not created in the regulations and then the implementation piece. And so although something wonderful was created, somehow things get lost and it creates a bigger barrier for folks in the when it's time to practice it. And so I also want to mention young people. So again, I work with young kids, and people believe that something happens automatically when a child turns 18, that all of a sudden they're this adult and their brain is functioning. I'm here to say that at least for the young people and my own children, like, that didn't happen. And so I say that to say that there aren't many services to fit young people, right? So again, and I can only speak for my work as examples, but I am currently working with a young woman now who aged out of programs. And the challenge that she's having right now is that she can go to a shelter, but those are adult shelters. And it's like she's still kind of not really there, who has a history of sexual exploitation and trafficking. And so there aren't many options for her as well. And then, so a lot of folks mentioned the cultural competencies. And then, so the other, was mentioned here. So my background previous to My Life, My Choice has been, I was a community organizer grassroots organizer for a really long time. And my focus was the criminal justice reforms in the criminal justice and education justice and immigration justice. So anyway, part of what I've realized is it doesn't matter, and again, I say this because as we think about wraparound services, one of the things that needs to be kept up front is that sometimes victims have criminal records. And so again, we have this, we create this plan, we're gonna get this person housing, we're gonna get them enrolled in education, and we're gonna do all these things, but then we look at, well, sorry, we can't get your housing because of your criminal record, you don't qualify for certain grants. And the other thing that was mentioned here was therapy. there are huge waiting lists, specifically like for young people, for kids. And so that's something that I'm hoping, you all can put your focus on, because as it was mentioned here, like it takes a holistic approach, like a familial approach. And part of that, I believe, and we've seen that works is therapy and family therapy. But when you're not, it was mentioned earlier that language, therapists that speak language, but then also in general, there aren't many therapists who are readily available. But anyway, I just thank you for your time. Thank you for allowing me to be here. And I gotta run. It was good to hear you all.
Thank you. That is it for public testimony. I'll go to my colleagues if they have closing statements.
I was nervous, and I said that at the beginning, for this hearing because of just like the weight of the issues, but these are the weight of the issues that you deal with every day, these stories. So I just want to thank this incredible panel. Thank you for answering the call when my office put it out to have you all come here and talk and give us the urgency that we need in partnership with our police department, in partnership with the district attorney's office to really be responsive. I have our marching orders in the things that you elevated, and so this was really helpful to me. I do hope that our goal should always be to eradicate all forms of violence. All forms. That's where we start. How do we eradicate all forms of violence? State-sanctioned violence, intimate partner violence, and gun violence. And we recognize that there's a lot of overlap in that. And I think it's possible. It becomes especially more possible when we work outside of our silos. And when we are providing the services in a culturally competent manner, which is something that's just so beautifully elevated so naturally from all of you because of the work that you do, both in language capacity and in challenging us to, I think it was someone who offered testimony to also be a bit more expansive in when we're thinking about intimate partner violence and who victims are. So, for everything from support for state legislation, cash funds, an act relative to language access and inclusion to help with 209A orders, an emphasis on resources, language capacity at BPD and the DA's office, cultural competency, breaking down silos, pipelines for multicultural therapists, prevention is better than the cure, especially in our schools. So thank you for highlighting that. Housing playing a crucial role in someone who started my career as an attorney, doing housing work in court. We don't have enough attorneys in general doing legal aid work, doing work to really balance out the scale. So thank you for elevating the need for us to work. I know Greater Boston Legal Services is there, but is not enough. The BRACC, the Boston Area Rape Crisis Center, they help with 209A orders, but there's a lot of work that needs to be done to fill those gaps. And so, I just take those as marching orders. And I know that my colleagues here who are still here at 5:47 are also have taken copious notes to think about how we work together to really end violence, all forms of violence, including intimate partner violence, domestic violence, sexual assault. So just thank you, merci un pile, shishi, obrigada, gracias, thank you to everyone who showed up and who offered so much of yourself and your heart, because I know that you do this from the heart because it matters so much to you, so thank you so much.
Can I mention something?
Sure.
Yeah. I just wanted to reiterate the gentleman on Zoom. I heard the officers mention that they don't see any difference in reporting, and we know that's not the case. Last week we had a situation with a DV victim refused. This was through Catholic Charities. She refused. The husband said that he would kill her. And the Catholic Charities told her that she has to report. She has to go to the police. And it took days. She refused. Mm-hmm. So finally, a lot of organizations tend to come to us. What do we do with this? Seeking advice. Yeah. So we finally talked with the woman in the right way, looking at the different options, and she decided to put in a police report, and she got a restraining order. Now, That's not going to be the case with a lot of newly arrived immigrants, whether they be Haitian, Dominican, Venezuelan, whatever the case is. Now, we are in an immigration crisis, just like we saw during the pandemic, the early years. At AFAB, the cases tripled in a short time. And these people did not want police involvement. So we have the same thing, even to a harsher level. So we have a lot of newly arrived folks, or they can be not so newly arrived. It's just that their status is not what we call legal. So those folks will be very reluctant in getting a restraining order, in filing a police report. But I know there's a last question coming. I also wanted to share that yesterday I asked one of our staff members to put in a survey and see what the community says. That's how we function. Grassroots, we try to get community involvement, client involvement, and I think we are up to 70 people right now. And we posed some questions in terms of key questions, but I want to share two things. Shelter, number one. Shelter, housing for our domestic violence victim, and legal service. We have a hard time getting legal aid. So yes, we do work with all of the different organizations, GBLS and so many others, the Nouveau, et cetera. But I think there's a dire need for domestic violence attorneys in the city of Boston. Yeah. So if you take that into consideration, I would love it. I would greatly appreciate it.
Thank you. Councilor Flynn?
And thank you, Madam Chair, for bringing us together for this important hearing. It's one of the most informative hearings I've been at in a long period of time. So I want to say thank you to you and to the Council President as well, but really to the panel for being here, for the important work you are doing, and for our public health team and Boston police officers as well that were here. Listening to you in your stories and your experiences helped me become a better city councilor and learn more about domestic violence, sexual assaults, reporting, services for survivors, the role of the courts, the role of the police, the role of the community. I was a former probation officer at Superior Court, and I supervised a lot of mostly men that were convicted of a lot of these crimes as well. But what I do want to focus on, Madam Chair, and especially as we go into the budget season, is how do we support nonprofits? How do we support survivors? How do we support our young kids in the Boston public school system, or people in the getting counseling through public health as well? How do we support them, and what is the role for us during this budget process to advocate for you, to advocate for various outstanding programs that you're involved in? So that's my focus going forward, and to I might even listen to the video again, because there's a lot of good information, and you provided a lot of good information. Madam Chair, I wanted to ask a question, but sure. I go to a lot of these hearings, obviously, to learn about a subject, but also the public does also, listening to this. But if there's a survivor that maybe picked up a little information that might be helpful to the survivor, but maybe to the chair, is there any way that this video could somehow be placed on social media so more people, especially survivors, could see it? Maybe it helps them as well.
Yes, definitely. We could see with Candace too, put it on the City Council Facebook, Instagram page, any other ways we can put it out there. And maybe even the public health, like social media and women advancement. Yeah, that's a good idea.
Thank you, Madam Chair. Again, thank you to the panel, and thank you to the administration team that was here. Thank you.
Thank you.
Councilor Flynn just reminded me that one thing that I meant to do in the beginning that we didn't do, especially for any survivors or for anyone who's experiencing any domestic violence or intimate partner violence right now, is to just give the number for SafeLink. So I just want to make sure that everyone and anyone who is listening has that information. Of course, if you're in an emergency, call 911, but SafeLink is the statewide 24/7 resource to help people who are experiencing domestic violence, and that number is 877-785-2020. Again, that number is 877-785-2020. Thank you.
Thank you. And you can always also, if you remember easier, 911 or 311 can always also connect you to those resources, but thank you for sharing that. Thank you for being here, to the administration who was here first and still here. You all do so much and help so many people, so thank you for that. You're making not just our city but this world a better place, and you care about people, and just your stories about how you advocate and how you show up in the population, which so many of us, you probably touch most people need your help, right? And there's just no way. I think, my job, I always feel like, I can never get to everyone, but it's not always the deep, hard work you're doing every single day. So the resources, but also, making sure you take care of yourself, right? And that you obviously have people that work with you that you must worry about also, who are dealing with this day in and day out. So that's important also. And you mentioned, Dawn, and all my years as a teacher, I always thought, the school nurse was always way more than a school nurse. She was, in the classroom teachers, but the advocates, right? These women, these people who find someone who understands them culturally, socially, and speaks their language, they just must not want them to leave, right? That they have finally found someone who will listen to them. And there's always so much more, right? It's like you start off, I would always say as a kindergarten teacher, the mom drops off their child and you're going to help them learn to read, but then they have finally found someone who can maybe help the older brother get a job, or they need food services. So it's the type of work that you're all doing. So just thank you for that, but also, like, how can we on the council support our departments? We do have so many departments, and thank you for being here, Women Advancement and all Moyer and everything, but it's the work that will keep us up at night, but thank you for advocating and also uplifting the children. And you mentioned the kids, but it's also, the mother of a victim, the brother. It's like everyone affected, the classroom teachers. And Councilor Flynn, you did mention it, but we do need to figure out, because I do know there's always been a disconnect between privacy, because you don't have to share with your classroom teacher, and many times you don't want to because it's a private thing and you may feel shame, but how can we help make sure that the schools are provided with services if there's domestic violence or when there's community violence, right? Like, we don't ping and make sure that neighborhood schools are aware, like, hey, this has happened in your community. You may need to look out for this. And something I know we can work more with Mark and the Public Health Commission on those types of issues. How do we help all of the families and members that are affected? But thank you for all you do. Do any of you have any closing remarks or anything else you want to say? I know this is, to me at least, the beginning, and like you said, Councilor Flynn, very informative of all the different agencies, departments, just people who are out there helping. But if any of you want to have any closing remarks before we end, please feel free. Yeah, definitely.
I just wanted to respond, Councilor Flynn, thank you for asking the question about how the city can support the work of nonprofits. And just one of the things that I wanted to mention, having done direct service, trauma response, organizing, policy work, and prevention, is when funding gets cut, very often prevention is the first thing to go. And I just don't want to lose that work. I don't want to lose the organizing work, because as was mentioned before, prevention is so much better than trauma response. We want to stop the trauma from happening in the first place. And the organizing work, particularly with young people who tell us what they need to be safe, who tell us what they need for their communities to be safe. And I really worry that that very critical work that also totally goes into prevention is going to get lost as we feel the impact of the federal disruption to funding.
Thank you.
I just want to echo your sentiments about the panel. I just want to say thank you to each of you for being here today, for doing everything that you do. We talked a lot about silos and breaking silos, and I think we did a phenomenal job in showing what that looks like. And I hope we can extend this conversation outside of this room. I also want to thank the Council President for inviting Shakira Story to be here today. This is the first time that you and the City Councils have shown the City of Boston that you stand with survivors and you believe survivors. Coming up very soon is May Day, which the Boston City Council has made an official day in recognition of Deja Nicole Jenkins Minus. So I just wanted to uplift her in this space, and also to say that for any teens or young people who are watching, vicariously hearing about what we talked about today, there are a plethora of options for you to choose from. And one that I did hear earlier today, and we got to work with, was Start Strong, with some young people who are phenomenal and on fire and have just as much expertise as we do on the issue. And so to your point, Councilor Flynn, in reference to how do we mitigate risk for young people, I think it's going after groups that work specifically with young people who are on the front lines answering the call to disrupt in the cycle would be a first start. Obviously calling us, but I think including them in the conversation, I think would have been incredible to have someone from Start Strong sitting up here with us in representation today for what this issue brings. And so I just want to say thank you for having us, for bringing the opportunity for Shakira Story to be in the room once again with some of our fellow partners. It is incredible to be here.
Thank you. Anyone else?
I just want to echo everybody's sentiments. Thank you so much for having us and bringing us to the table.
I appreciate that. Thank you. This hearing on docket 0183 is adjourned.
Thank you.
Thank you.
Thank you.